Whiskey.
So, Mr. Ridley, after the Prime Minister had been presented with the advice on the 7th of October, Sir Patrick Vallance refers in his evening notes to a meeting in number 10, 273901, page 216, thank you. It's dated the 8th of October. Very bad meeting in number 10. Prime Minister talks of medieval measures than ones being suggested. Perhaps we should look at another approach and apply different values. Surely this just sweeps through in waves like other natural phenomena, and there is nothing we can do. As Simon Ridley said, final slide. PM said, whiskey and a revolver. He was all over the place. Chancellor using increasingly specific and spurious arguments against closing hospitality, both of them clutching at straws. The inquiry is very well aware of reading too much into WhatsApps and diary entries. But do you recall the tenor of that debate and the mood in the meeting?
This is the meeting we looked at the note of just before lunch. It is definitely the case that the Prime Minister and the Chancellor didn't want to, put in place circuit breakers at that point. I don't recall the specific phrase that Patrick notes, and the Chancellor certainly was arguing against closing hospitality, and there was a debate about the extent to which sector closures would have the suppression impact that we were stating it would.
Sir Patrick Vallance identifies only 3 choices for high prevalence areas, i.e. those areas that would end up in the level 3 tier. Do a proper lockdown, and essentially level 3 tier was, as you say, a regional circuit breaker. It was a high level intervention. Use military to enforce the rules, do nothing and do a Barrington Declaration and count the bodies. When will they decide? So as you say, the Prime Minister and the Chancellor were resistant to, and the nature of the debate and the tension and the terrible choices they faced are absolutely apparent and known to the inquiry. But they were resistant to the tenor of the scientific and other advice being presented by the CTF.
I don't recall going through those 3 options in the way they're articulated.
No.
As you say, these are just Patrick's
take on it.
Evening notes. They definitely, the tenor of the debate was to not do one, if you like, as per this list, and to continue regional restrictions such as we were, and increase enforcement and increase the use of test, trace and isolate.
So curfews, restrictions on hospitality, enforce more, but not impose what was effectively a regional circuit breaker, the level 3
exactly,
tier.
and the decision following this meeting was to bring the tiers in and negotiate tier 3 with regional areas, which we may be about to come to.
As the CTF, epidemiologically, was there really much option?
So much option.
But to impose this tier regional circuit breaker system?
Our recommendation in this meeting was essentially a circuit breaker over a reasonably wide geographical area, at that point in the northeast, the northwest, and a large area of Yorkshire, as per the map you referred to earlier.
Following the meeting with the Chancellor on the 8th, the Prime Minister told the Cabinet Secretary that the government should seek to start negotiations with the local areas, because this is a regional system. There had to be negotiation with the local authorities, the local mayors. And in summary, is this right? Negotiations began on the 9th of October. There was a COVID-0 meeting on the 11th, a cabinet call on the 11th, and on the 12th, the Prime Minister announced the 3-tier level 1, 2, 3 system of COVID alerts in England. Greater Manchester went into tier 3. Liverpool went into tier 3. I think Liverpool went into tier 3 first, followed by Manchester about a week later, followed by South Yorkshire, Coventry, Slough, Stoke-on-Trent into tier 2. So there was a change in the position. Various authorities moved up the tiers. I do want to spend time debating the practical difficulties of the tier system, because in the event it failed to stop the incidence of the virus and we ended up in a lockdown. But you identify in your statement a number of real difficulties with the process. Firstly, the regional areas, the mayors were, of course, opposed to any suggestion that their area be placed in a higher tier, of course. Secondly, there were difficulties with negotiating with the regions the nature of the restrictions and also what financial support could be provided to them, correct?
Yes.
There were requests for additional funding, and the negotiation took time, and not every region was prepared to agree a package, correct?
Yes, that is correct.
And there was confusion to the public, you thought, because there were difficulties associated with how to communicate to the general public the different measures, the different impacts of the different levels, and of course whatever area was in which level. So it was a difficult process. When did it become apparent to the CTF that the tier system was not doing enough to reduce the level of incidence?
I think to answer that, if I may, can I just describe a bit what happened in the few days, because there were some different things.
Yes, of course.
In there, and we had been discussing tiers with the Department of Health and other departments as a concept in terms of regularising local restrictions prior to the 7th and 8th of October. Following that meeting on the 8th of October, as per the note, there was a subsequent discussion between the Prime Minister and the Chancellor, and on that Thursday evening, the decision was made that we would start the negotiations with local areas, and as you say, we started those on the following day, the 9th, before that is before the formal agreement to tiers, which happened in COVID-0, I think on the 11th. I mean, you've listed the reasons I put in my statement. I won't repeat them, but we went into those negotiations incredibly quickly because of the urgency. And I mean, it was apparent very quickly that negotiating a tough enough tier 3 with local areas was going to be difficult for all the reasons I described. The meeting on the 11th then agreed the tiers 1, 2, and a sort of baseline for 3 with an agreement that we would further negotiate the sort of tighter restrictions with areas from the 11th. So the distinction in response to your question is it was not the case either sort of prior to the 11th that tiers in and of themselves wouldn't work, and that an approach locally to suppressing the virus differentially, depending on prevalence, wouldn't work. The negotiations, and that as a mean to get tough enough restrictions in tier 3 areas, it was clear pretty quickly we wouldn't get there. Indeed, as you say, we got an agreement with Liverpool city region quite fast over a couple of days, but the discussions with other local areas went on much longer, and I don't in fact think we got there with Greater Manchester.
Forgive me, I wasn't suggesting that the government knew that they wouldn't work on the cusp of trying to put the system into place and negotiate with the regional authorities. When, as October rolled through and the virus began to spread, did it become apparent that the tier system, which obviously had involved some regions going into tier 3 and some regions going to tier 2 and perhaps the balance into tier 1, I can't recall, wasn't going to reduce the level of incidence sufficiently fast?
So I think we knew as we were continuing to go through October. I mean, prevalence was continuing to rise. The general movement was up the tiers, if you like. Tier 1 areas were becoming Tier 2 areas, Tier 2 areas were becoming Tier 3 areas, and it was, as I say in my statement, clear that we'd end up having to have negotiations with large numbers of councils. So as a way of pushing back the virus quickly, we could see as we went through other meetings and discussions in October that was unlikely to work. I think retrospective work suggested Tier 3 at least was slowing things down, but we didn't at that point have the time for all of that to play through.
So here's the question in relation to the tier system. I was asking you earlier about why this formalised system, a regional circuit breaker, wasn't put forward as a specific option in September. Do you think that if this tier system, which was announced, as I've said, on the 12th of October, had been developed further, introduced and negotiated in September, when the levels of incidence were necessarily lower, it would have stood a greater chance of success?
Yes, I think that is fair. I think the tiers themselves would have had to have been stringent enough, and we would have had to have applied them quickly enough in local areas and over a broad enough geography to have an impact. So they're kind of, but in general, yes, that is a.
And had they been imposed in September and the negotiations had taken place, there is, you would accept, no doubt, a greater chance, although we will never know how great, that it would have worked and might have avoided the need for the subsequent national lockdown.
Yeah, I mean, I think that is possible. As I say, when we kind of get to 2021, we decided against regional approaches for lots of reasons, reflecting back, and that opening back up in 2021 was best done nationally, but it's uncertain. It's certainly the case that if we acted more strongly earlier, we'd have stood a fairer chance of avoiding a national lockdown.
On the 25th of October, there was a forward strategy meeting in Chequers. And it was apparent to everyone there, of course, that cases were continuing to rise. By the 25th of October, it must have been apparent that the tier plan, the tier system, was having an insufficient impact in terms of the rise in the virus spread. INQ 252880 details a number of strategies for the months rolling forward. So November to December, and then January to January, and then March to April. I suppose seasonal strategies. Is that correct? The strategy meeting on the 25th of October was held in order to try to chart a course going forward as to the possibilities that might eventuate.
Yeah, I think this was a sort of schematic sort of approach that was subsequent to the meeting. I don't think this is what we discussed in the meeting on the 25th.
136672 is a readout from Imran Shafi in number 10, in which he refers to the PM meeting the team today on the forward COVID strategy. James Bowler of the CTF set out the overall potential course to spring, including rising numbers followed by a plateau. We needed to understand now what our strategy was to Christmas. In the bottom third of the case of the page, you set out the strategic choices ahead. We would need to decide how to respond to the LCR's upcoming 28-day review. There was a debate about the general shift towards Tier 3. Is that what's been described as the epidemiological levelling up?
Yes.
The fact that areas went up towards Tier 3. There was an option to bring some of this forward, as well as introduce tighter measures within a tiers framework or a national circuit breaker. The PM was keen to see the economic impact of the various scenarios. So was this a meeting at which not just the strategic course going forward was debated, but also a warning that cases were rising, there might need to be a consideration of tighter measures in a tiers framework, as well as or instead of a national circuit breaker?
I mean, yes, essentially, this is sort of the next in a sequence of meetings we had through September and October, and it was reasonably clear we would need to take further action because of the tiers, the country moving up the tiers, as well as the regional fire breaks as they're described here, which we talked about before we talked about a national circuit breaker.
252878 is an email to you, I think, from an official in the Cabinet Office after that Sunday meeting. It says Sunday meeting follow-up. Simon, is that Simon Ridley?
Yes.
You, Emma Payne. In the end, I thought that did what it needed to. What did the meeting do what it needed to?
So, I mean, I think the meeting, I wasn't party to the setting up, but the purpose of the meeting was to try and stand back a bit from, again, from the sort of day-to-day sort of rush of meetings we'd been having, and again, to set out where we were, the trajectories, how the policy was working on the ground, and to sort of debate what the options were without the meeting seeking to kind of come to a decision. It wasn't a decision-making meeting. It was a let's get the evidence out and sort of understand where we are and offer options meeting. And Ollie was one of the key members of the task force. He and Emma were the leads on a lot of the strategy work. And I think what he is saying here is we sort of successfully got the issues on the table and discussed the need for further action. The conclusion: it's bad, but we aren't stampeding into lockdown. We push on tiers and we prepare for the big decision. The conclusion, that is, was broadly as we would have anticipated. What did you understand by Mr. Illott's reference to "it's bad"? What was that a reference? Did you understand it to was it a reflection of the general state of the country in terms of the spread of the virus and the terrible decisions which may then be necessary to take, or bad as in bad the Prime Minister's reaction? No, my recollection of the time is that this was a description of where we were in terms of the condition of and prevalence of the virus in the country, and the need to suppress it. In his notes, Sir Patrick Vallance refers to a meeting with you, 273901, page 597, Ridley meeting. Was there a meeting did you have a meeting with Sir Patrick Vallance separately from that meeting at Chequers on the 25th? I expect I had a call with Patrick, possibly others ahead of that meeting to explain what I thought it was about and what we as the task force were intending to put into it. Positioned PM meeting, that may be a reference to the forward strategy meeting, as a chance to step back but avoid making a whole load of decisions that then get undone by the Chancellor. I asked what PM thinks objectives are. Quote, what he wants to achieve is a series of mutually incompatible options. Did you say that? I mean, I don't recall exactly what I said, but it's perfectly plausible because we were, wrestling the need to suppress the virus with the consequences of a lockdown, and we were at the point where we were going to have to do one or the other. In blunt terms, was the purpose of the forward strategy meeting to try to put the Prime Minister in a position of being able to make a decision, perhaps including a national lockdown, in a way that wouldn't result in him changing his mind or being, quote, undone by the Chancellor? I mean, yeah, I think we were seeking to debate the options without forcing a decision that wouldn't stick, so that we had the space to explain where we were, the likely future path, and the implications of that. The reference to the Prime Minister being positioned, or rather the meeting being positioned, and to the strategic aim of trying to avoid decisions that would then get undone,
and to the possibility that the Prime Minister was regarded as wanting to achieve mutually incompatible options, smacks of the COVID task force trying to usurp, perhaps, the discretion of the Prime Minister to try to push him towards an outcome, to achieve an end. Would you agree?
Certainly not trying to usurp the position of the Prime Minister. It was our job, as we've described, to pull information evidence together and to give advice and make recommendations. We'd made recommendations on the 7th of October, where we had thought that essentially regional circuit breakers was necessary. By the 25th, we thought further action was necessary, and we were. I mean, the meeting was not my proposal, or I don't exactly know recall where the meeting came from, but it was a chance to try and explain, with more space, the issues. I think at this point it was my and our view we needed to take further action. The negotiations with local areas were not leading to strong enough measures quickly enough, but I don't think we were doing anything other than trying to give advice.
On the 28th of October, the COVID task force prepared a further advice, I think in the name of James Bowler, your colleague, 146617, in which, and the handwriting is that of the Prime Minister, the note provided an update of a COVID strategy following the discussion on Sunday. It is for information, not for decision. In essence, the note told the Prime Minister that the situation had continued to deteriorate. It said, we do not expect the current approach to tiers to be sufficient to bring R below 1, although the data is not yet conclusive. We're working on options to go further. And then in the state of play, at the bottom of that page, there are the grave figures given about the spread of the infection. We'll just scroll quickly through the document. Page 2, paragraph 6. There's a reference to national interventions being deployed in France, Germany, Ireland, Italy, and Wales. The Prime Minister's put a question mark, exclamation mark next to it. Paragraph 7, you don't expect that the tiers will work because most of England will move quickly to the current tiers policy. That's the epidemiological levelling up. Page 3, paragraph 10. We're considering a range of options should you choose to act in November. The Prime Minister says, why not put everyone into level 3? And then he provides his handwritten comments on pages 7 and 8. And I've taken the hint from a lady. I'm not going to put to you what you think of his comments. They're a matter for the Prime Minister. But essentially, he expresses his terrible frustration at the conundrum in which he is being placed. Paragraph 4. What do we really achieve by smashing up the economy if we have no idea how many times we're going to have to do it? Paragraph 5, the long-term cost to health and well-being from the lockdown strategy. Paragraph 6, he fulminates on the average COVID mortality ages, 11 to 15. What happened to mass testing? What about the moonshots? How can we get people to self-isolate? Is NHS test and trace actually achieving anything? It might be worth just reflecting on paragraph 22 or point 22. He raises the issue of whether or not there can be an analysis of quality-adjusted life years. And he asks for serious economic analysis, finishing with the words, we're causing such long-term poverty that we need to consider jacking in essentially this strategy. Why wasn't all that information in that note from the COVID task force put into the advice document for the strategy meeting in Chequers? Why did the COVID task force having attended the strategy meeting on that Sunday, the 25th of October, returned to the fray with a further detailed advice just 3 days later, promoting the need, advocating the need for further options, but which plainly meant a national lockdown.
So, I mean, the note on this note came about in terms of trying to take forward some of the issues that came out of the meeting on the 25th. I mean, I should say the decisions here are incredibly difficult. I mean, I don't demur from that at any point. I have every, the Prime Minister was in a position where he was having to make exceptionally tough decisions that were going to have, significant negative impacts on a number of people, whichever way he went. He already had, and he was going to have to. I think the plan that we had worked very hard with colleagues across government to put in place around local restrictions, test and trace and isolate, and all these issues we had been doing for the last few months, and a number of these questions are in other notes and other discussions and other bits of advice. But we were at this point in time where it was our judgment that, where we had got to, we were at a point where to suppress the virus sufficiently, we were now going to need to take further action. We went back, I think, to the. I think the Prime Minister's direct notes here got formally put to us through his private office. I suspect it was in an email from Imran, and we sought to go back on those issues. But at this point, we were, I think, heading towards needing to take further restrictive action to reduce social contact.
The Prime Minister did not, as a result of this advice, dated the 28th of October, order a national lockdown, did he?
No, we continued implementing what we had been since the 9th of October.
Yes. So 2 days later, the COVID task force sent another advice to the Prime Minister, did it not?
I think we did a paper for a further paper for discussion on the 30th. Yes.
2 days later, the COVID task force again sought to promote a debate about a national lockdown, because 146710, you presented a paper to COVID-0. Was that strategy for COVID-0 or for the Prime Minister?
It was a discussion that the Prime Minister had, I think, with the Health Secretary, the Chancellor, and Chancellor of the Duchy of Lancaster, which was a COVID-0 discussion that agreed what became the second lockdown.
Why, putting aside the issue of why you returned yet again with another piece of advice in short order, in quick succession, why was this advice addressed to COVID-0 and not to the Prime Minister directly?
I suspect there was a discussion with the. There may well have been a discussion with the Prime Minister before we got to the COVID-0 meeting that day. I can't remember the precise sequence, I'm afraid.
It's a relatively short note. If we can just scroll through, it's only 2 pages. And it essentially says the epidemiological position is that we must have a national lockdown. And it recognises, of course, the significant impact on jobs and the economy in paragraph 9. Why wasn't that call to the Prime Minister for a national lockdown put into the paper or the meeting or the debate 2 days earlier on the 28th?
So, I mean, to be honest, I can't recall exactly over these few days why the sequence of the papers. I think it was reasonably clear we would need to take further action in the direction of that. We set that out for information for the Prime Minister, as you've said, on the 28th, and that led to this meeting on the 30th that made the decision.
The suggestion I put to you, Mr. Ridley, is that the COVID task force, obviously for credible and proper reasons, was seeking to manage the Prime Minister. It was advocating a national lockdown. And when the Prime Minister essentially resisted in the strategy meeting and 2 days later ordering such a lockdown, the COVID task force returned to the issue again to say to the Prime Minister, our recommendation is a national lockdown. You repeatedly tried to secure that end. Is that a fair summary?
I don't think so. If you go back, I mean, just going back to the 7th of October, we were recommending strong regional circuit breakers in line with the overall approach the government was taking of not wanting to act through a national lockdown, but we were saying that to suppress the virus in the highest prevalence places, we needed to take stronger action than we're currently taking. That became negotiations, which we then worked extremely hard with colleagues across government to put in place immediately from the next day, with lots and lots of councils across the northwest, northeast, and Yorkshire. We ran those concurrently over a number of days. That proved through those discussions, we did not get to agreement with lots of areas for stringent enough measures. So we were not making the virus was continuing to spread and spread rapidly because the pressures that was putting in on the health system and elsewhere. We then therefore came back to the discussion of the action we should take and explored the issues with the Prime Minister on the 25th, sent him further information in the wake of that on the 28th, and then made the recommendation for the national lockdown only on the 30th.
Was the decision taken by COVID-0, the Prime Minister, or Cabinet?
The decision was taken by COVID-0, which I think on that occasion was attended by the Prime Minister, the Chancellor for the Duchy of Lancaster, the Health Secretary, and the Chancellor.
Given what you've said about the possibility of the tier system being proposed and implemented in September, and whether or not that gave rise to a possibility that a lockdown may not have been necessary, do you consider that the national lockdown, the second one, was avoidable in any way?
I mean, I honestly don't think I know, I'm afraid. I think that the second, as I think we were said earlier, we would have had a better chance of avoiding the second lockdown if we had taken stronger action regionally sooner, successfully established isolation through the period, successfully got broader compliance with regulations and with other guidance, which is what the government was pursuing. We didn't, and we ended up there. I think there are difficulties with a regional approach generally because of movement. We do not have the way the governance of the country works. Implementing regional measures on a broad enough geography is quite difficult. So I don't know.
On the alternative premise that a national lockdown was inevitable and the right decision to take, do you consider that it should have been imposed earlier?
I mean, as I think I've said, I certainly think we should have taken stronger action earlier. In hindsight, if you like, the regional approach didn't work, and therefore earlier national action may well have been better. But that, as we know, comes with other consequences.
Two final questions, please. I asked you questions about data. Did the CTF create a small team to examine data on disproportionately impacted groups in the summer of 2020?
Yes, we did. I mean, actually, to do more than examine data, to look at the data that was there, understand it, and to develop a set of propositions for what we should do to address the substantive issues.
Secondly, did the CTF take part in the process of trying to draw up, or rather directing the drawing up of regulations, the regulations which governed us all, in reflection of the policy decisions that were being taken, or was that a matter for the Department of Health?
So we had a team in the task force that essentially drew together the policy decisions and essentially the instructions for regulations. The regulations were drawn up by the legal team at the Department for Health and Social Care and signed by the Secretary of State for Health.
Thank you very much. Lady, those are all the questions that I have. I know there are a number of questions from the core participants, but I don't know what time constraints are being placed on them.
Mr. Thomas, you can't deceive me by moving places with Mr. Weatherby.
Good afternoon, Mr. Ridley. My name's Leslie Thomas and I act on behalf of the Federation of Healthcare Organisations, and I've got a small handful of questions for you. In your statement, you describe a number of meetings in 2020 regarding NHS capacity. So, for instance, at paragraph 49 of your statement, you say, quote, NHS capacity was the paramount, immediate and urgent concern at the outset of the pandemic, and prevalence grew and hospitalisations rose quickly. Question. Did safety of NHS staff feed into those discussions?
Yes, they did, and they were certainly a consideration of the NHS leadership.
Okay. To what extent, if any, was there discussion about vulnerability of NHS staff?
There was, I think, discussion of vulnerability of NHS staff. It was a matter that was being addressed and led by the NHS.
Well, let me just add this, because the Cabinet Office is aware of data from Public Health England, dashboard meetings and elsewhere about disparity in mortality and poor outcomes amongst black ethnic minority healthcare workers. That's correct, isn't it?
That is correct.
All right. So what was the response to that?
So in response to that, we set up the team I was referring to with Mr. Keith a moment ago on disproportionately impacted groups. As it in the round, it was broader. It wasn't about particular sectors of workers, but there was there was a lot of data, as you say, about worse outcomes for different ethnic groups, particularly for black and minority ethnic groups. We worked very closely with the Racial Disparities Unit in the Cabinet Office, with colleagues in other departments, and essentially set up a programme of work across government, and actually identified a senior official in the Ministry of Housing, Communities and Local Government to lead that across government, to look at that data and to look at what policy or operational changes we should make across government and across different sectors to address those issues. That very much included the Department of Health. It also included Ministry of Housing, Communities, Local Government, the Department for Transport. A lot of public-facing roles, such as were important. The implications for around worse housing were important. Multi-generational households were important. That came to a COVID-0. That was set up for a COVID-0 meeting in September. There was a view the package of measures needed to be strengthened, and the Chancellor of the Duchy of Lancaster wrote to his cabinet colleagues in the wake of that. That came back to a further COVID-0 discussion in October, and a set of decisions. And the Minister for Equalities, who I think at the time was Kemi Badenoch, MP, gave a quarterly update starting in October about those issues, and we put in place a number of policy measures, particularly working closely with local authorities and directors of public health.
Thank you. I'm just going to remind you just to slow down a bit.
Sorry.
I didn't want to interrupt you, but
I've done
you
right
were
on that
going
so
at a
far.
pace there.
My apologies.
Right. Let me move on to the second question that I have. Your statement states that on the 20th of March 2020, it was noted that hospitals had limited PPE stock and that as a COVID-19 strategy ministerial group meeting on the 13th of April, the lack of clear strategy in relation to PPE was discussed. Now, Mr. Ridley, let me just put this to you. You accept, do you not, that adapted personal protective equipment, PPE, for ethnic minority healthcare staff is relevant for several reasons during a public health crisis such as this? You would accept that, wouldn't you?
Yeah, it's important that we had the right PPE, yes.
So my question is, were any concerns raised about Black, Asian, minority ethnic healthcare workers requiring adapted PPE? For instance, taking into account cultural, religious considerations, diversity in terms of body sizes, shapes, language barriers, anything like that?
So, can only, my recollection in this area is one that I think came up in earlier hearings where Helen McNamara raised PPE for women. That issue came to a discussion later, I think it was in April, where Lord Stevens responded around some of the broader adaptive PPE that was needed. But I don't have further recollections about the different types of PPE and precisely what was needed. The focus for myself and the team in the Cabinet Office was in making sure we had the work in place across government to procure all the necessary PPE. The commercial procurement through the NHS and Cabinet Office colleagues then sought to address that. Beyond that, there's nothing further I can
Sorry,
add.
can I just press you just a little bit? This is my last question. I just want to be sure on what you're saying. So concerns were raised, were they, about adaptive PPE for ethnic minority workers? Concerns were raised, were they?
Concerns were raised in my recollection about adaptive PPE for women. That's the only recollection I have where the issue was raised with me. There was a discussion about PPE where Lord Stevens broadened that out to the different types of PPE and different adaptations of PPE. I can't actually remember the list of things he raised, but the detailed procurement of PPE was not something that was part of what I was responsible for.
So you can't assist us as to what action, if any, was taken in relation to concerns that were raised?
I cannot.
Thank you.
Thank you, Mr. Thomas. Mr. Mennell.
Thank you, my lady. Mr. Ridley, I ask questions on behalf of a number of children's rights organisations. Earlier today, you told Mr. Keith that the role of the CTF was to provide policy advice to the PM. When considering non-pharmaceutical interventions, was there any discussion in the CTF about the fundamental differences between how lockdowns and social distancing restrictions impact children as opposed to adults?
Yes, there was a lot of discussion.
And what was the nature of that discussion?
It took various forms. There was a lot of discussion about the implications on education.
Beyond education,
and schooling. There were discussions about the implications for caring and very young children, and indeed some of the reforms of MPIs that we made in the autumn around what we called support bubbles. Some of those were about addressing issues as they pertain to particularly very young children and children with particular disadvantages and needs.
Was there a recognition that isolation of children is simply not comparable to isolation for adults, as the inquiry heard in October from a professor of public health? Was there that kind of recognition?
So we certainly had discussions about the consequences of and risks of isolation. I can't recall detailed discussion about how the differential impacts of isolation in great detail between different groups, but certainly in thinking about policy, as I say, we were taking into account the differences for children.
Are you going so far as saying that there was a recognition that the restrictions had a disproportionate impact on children within the COVID task force?
No, I'm saying there was a recognition that the restrictions and isolation had significant negative consequences on a wide range of the population. I cannot recall specific the sort of detail of differences between children as opposed to elderly people as opposed to anybody.
Are you aware that in the summer of 2020, as an example, Scotland relaxed the social distancing rules for children under the age of 12, and later in September, Wales relaxed the social distancing rules in relation to children under 11. Were you aware of that at the time on the CTF?
Yes, we were aware of that. We did a lot of engagement with the devolved administrations.
And yet that didn't translate into any changes for children in England, did it?
No, we retained the same restrictions in terms of the numbers that could gather.
Why?
Sorry?
Why?
So, I mean, it was the balance between, if you like, the clarity and simplicity of a single number for gathering versus the fact that different exceptions and different rules for different types of people could better adapt to the variety of household and family structures, but brought with it more complexity. And in the end, we in terms of gathering limits, we stayed with simple numbers of individuals.
What is complex about removing restrictions for children under the age of 12? It's simple and straightforward. Everybody can understand that.
I mean, with all these things, it was a judgment. We were discussing the guidance and the regulations as we tried to address different impacts for different types of people, as we tried to address the different way in which people live their lives, which is inherently incredibly complicated and varied across the country. The regulations and the guidance got more and more complex as in the round, and that in itself became a problem. It became harder to communicate it. I'm not seeking to say we got all these judgments right. There may well be restrictions we put in place that we shouldn't have done, and exceptions we put in place that we'd have been better off not doing. But we were trying to strike a balance overall between enough clarity to communicate what the rules were, and enough complexity, if you like, to try and mirror the fact that society is complicated and the inherent harms for different types of people are different.
But are you saying, I just want to be clear about this, are you saying that the CTF positively advised the UK government not to go down the route that Scotland went down in July and Wales went down in September?
I confess on this issue I cannot completely recall what we advised. We definitely knew about it. We definitely discussed it. We would have put the issues and the options together. There was certainly advice we put about the choice between gathering limits about simple numbers of people and gathering limits about different numbers of households, and we had those debates. I'm afraid I can't tell you in the room exactly what we recommended at different points.
And was that based on any evidence or any research, or was that simply a decision plucked out of thin air?
It was based on evidence and research we had available and were aware of at the time, but ultimately we were across the piece making a series of judgments both in our advice and in the decisions that ministers ultimately made.
What evidence? What evidence that the English model was better than the Scottish model?
Well, we didn't have any evidence that the English model
Well,
was
you just
better
said
than
you
Scottish.
had evidence. That's why I'm
No,
asking what
sorry,
evidence.
they're different types of. I mean, forgive me. I was saying where there was evidence available and we were aware of it in general about the impact of different gathering limits, and it was pretty scant, I should say, because we were doing this was all new. We sought to use it. There was not a comparison, as I recall, between the efficacy either in terms of the impact as part of a set of MPIs, nor in terms of families at the time we were taking these decisions in the autumn of 2020 that in detail compared those models. So we were making a judgment based on the information we had available and in the round what the set of measures we had in place were.
To be fair to you, Mr. Ridley, at page 369 of your statement, you do say that some lessons were learned by 2021 and some changes were made, and you specifically mention exempting very young children under the age of 5 from some restrictions. This is January 2021. Why then only children under the age of 12? I mean, why not children under the age of 5? Why not children under the age of 12, as others had obviously done many months earlier?
I mean, I'm at risk of, I fear, repeating myself slightly. I mean, we made changes to the MPIs and the restrictions to try and create exceptions where we thought they were necessary for the welfare of different groups. As we went through, we actually expanded support bubbles in November 2020 for very young children, I think under the age of 1. We expanded some of that again in 2021. We had, and I'm sure discussed, lots of different options. The decisions were made, as I say, in the round as part of the overall MPIs that we had. We were seeking to learn the lessons from the very stringent lockdown at the beginning with respect to society. That was necessarily a set of judgments.
And were you aware at the time on the CTF that children's rights organisations and indeed the Children's Commissioner for England, Anne Longfield, were calling for children to be exempt from social distancing rules, as there were serious concerns about the impact on children's well-being of these rules? Were you aware of that on the CTF?
I'm sure we were. I cannot give you a specific recollection of when, but we were working very closely with other departments and other organisations across government and beyond to try and maximise the information we had. We won't, as I say, that won't always have been complete.
Finally, this, on the issue of disproportional impact, could we please have on the screen 137239? Mr. Keith had this on the screen earlier. This is the recovery strategy from July 2020. Thank you. And if we could turn to page 10, please, top of page 10. I'll just read this out. We now have sufficient testing capacity. No, sorry, that's the wrong page. 1 second. Yeah, I'm just finding it on my laptop. Sorry, Mr. Ridley, 1 second. No problem. Yes, while these impacts have been widespread, that's the impacts of the rules and restrictions, they have not been equally distributed. Evidence shows the varying impacts on different groups of people or people with specific characteristics, including but not limited to BAME individuals, single parents, disabled individuals, victims of domestic abuse, and low-income groups, many of whom have been disproportionately affected. Now, I appreciate that it makes it clear here that this is not a full list, but it's right, isn't it? There doesn't seem to be any acknowledgement here in the recovery strategy of the disproportionate impact of the rules and restrictions on children.
So, I mean, you are right that this list does not include children specifically, I don't think we would have. I mean, they would have been included in terms of our thinking about disabled groups, black and minority ethnic and low income groups. But you are absolutely right. We have not listed children as a cohort, if you like, in and of themselves in this sentence.
And the only mention of children that I've been able to find in the recovery strategy is on page 15. And I think, to be fair again to you, you should see it, where there is a paragraph that addresses the reopening of schools planned for September that year. Do you see that?
Yes, I mean, I think we, and indeed ministers in the government, were very, very concerned about the impact of lockdown on education and on schools, and sought as far as possible to keep schools open and to maximise the support when they were not.
I mean, and with the exception of that single issue of the reopening of schools, I mean, this is it not, largely a recovery strategy for adults as opposed to children?
I mean, this was a recovery strategy applied to across the whole country. I agree. There is not detail in here on children in the round. When we get to the winter plan in the autumn, we do seek to increase the flexibility around some of the constraints for some groups of children through the widening of support bubbles. But you're right, we did not go as far as other parts of the UK in England.
Thank you, Mr. Ridley.
Thank you, Mr. Mann. Mr. Metzer.
Thank you, my lady. Mr. Ridley, I have a few questions on behalf of the long COVID groups on 3 short topics. First, long COVID and the plans in response to the pandemic. Can you help us, please, as to why there was no reference to long COVID in the COVID winter plan of November 2020, when the DHSC had issued a public statement warning of the risk of long COVID just a month earlier?
I mean, we were focused in the winter strategy about the plan to try and keep the suppression of the virus low enough to reduce COVID harms for everybody that caught it. We did not refer to long COVID specifically. I don't recall the extent to which there was a sort of a kind of clear and agreed definition of long COVID at the time, but we were concerned about COVID harms in the round, not just about hospitalisations.
Yes, I think, I'm not going to go over it, but I think it's been well established and clear from the DHSC about long COVID generally. But do you agree that people, primarily the young, still needed to know that there was an indiscriminate risk of long-term harm from COVID-19?
Yeah, I think it's important that people knew the risk they could face from catching COVID-19. We sought to communicate that through a number of means, including the work around the clinically vulnerable, which we were. I mean, that was driven by by medics, and that changed in the winter plan. We adapted that to include some new groups to improve the communication of that risk.
Would you accept there was a failing by not referring to long COVID so that people could know and seek appropriate treatment if they had long-term symptoms?
I don't know whether there was a failing in that. We were, as I say, seeking to put in place the policies to keep the level of the virus under control, and I think there was a lot of communication about the potential risks to COVID, albeit that we weren't discussing long COVID in and of its by that label.
Secondly, advice given to the Prime Minister on long COVID. Did the CTF advise the Prime Minister on the risk of long COVID before January 2021?
I'm not sure that we put specific advice up about long COVID as sort of labelled as such. We were concerned about the risks of high prevalence to those that are most vulnerable.
So is that an agreement that the CTS didn't advise him before then?
I don't recall notes from us on long COVID specifically.
On the 13th of April 2021, the CTF produced a detailed paper, In Depth, Long COVID, which covers prevalence of long COVID, its socio-economic impacts, including the economic cost of workplace absenteeism and the cost of long COVID in QALYs and its impact on the health system. We don't need to go to it. The reference is 292660. I'm sure you know of it. Why did the COVID task force produce this paper?
This was a paper that was produced by our data and analysis team, a part of it, which over the course of, particularly from sort of, I think, November, December 2020 onwards, did a number of pieces of work in depth on different aspects of COVID and different implications. We did similar bits of work on educational impacts and so on and so forth. I think the reason we did one on long COVID at this point was because it was an issue that was coming more towards the forefront. There was also more information and more evidence about it. I think it's about the same time the ONS have started to collect data on long COVID, and the purpose of us doing these notes in general, including this one, was to pull that information together from across government so that we had the best and most rounded picture of it that we could have to inform future decision making, which in this case was the opening up from the third lockdown.
Do you consider that this paper had any impact at all on government discussions on long COVID?
I would like to think so, yes.
Can you elaborate at all? Can you assist us?
I think if you turn to the February roadmap that we published to set out the plans for opening after the third lockdown, I don't think it refers to long COVID by name, but we're very clear about the risk of extended symptoms for a number of people as a result of catching COVID, and that was informing the way in which we wanted to open up and the length of time between steps to make sure we did that in as successful a fashion as possible.
Do you agree that long COVID was known about well before April 2021, wasn't it?
Yes.
Last area I want to ask you about, COVID-19 dashboards on long COVID. Why was the data on long COVID gathered by the DHSC and the ONS excluded from the COVID-19 dashboard?
I don't recall that it was fully. I mean, the ONS data we put through the dashboard. We could only show a portion of the data we had available at any one meeting. I don't think there was a decision to exclude it.
Well, Mr. Ridley, do you agree with me that the data on long COVID was in fact never featured as part of the COVID-19 dashboard?
I honestly can't recall all the dashboards. You may be right, but I don't know.
On the assumption that is right, do you agree that not feeding this available data on long COVID into the main COVID-19 dashboard deprived you, the CTF, and thereby the public, of vital information on the prevalence of long COVID?
No, I don't think I do agree with that. I mean, as we've just discussed, we've done a overall evidence and analysis note on long COVID. The ONS collected long COVID data. That ONS data was very, very widely available across government, including the task force in the Cabinet Office, but across other departments as well. And it was fantastic that the ONS were collecting it.
Yes, but the absence of available data on long COVID meant surely that there was insufficient information such that that might have meant that long COVID was not factored into decision making.
As the ONS started to collect data, we had more information on long COVID. I think there was a debate and a degree of a lack of clarity about exactly what long COVID referred to specifically. There was clarity that there was a risk of long-term sufferance from symptoms for a number of people who caught COVID. We sought to reflect that in the policy we made, particularly through 2021, and the data that was available as a result of the ONS's work was very widely available.
More generally, but the available data on long COVID didn't feed in, did it, to the COVID-19 dashboard, which was significant?
Well, I mean, as I say, I don't recall exactly what was and wasn't in all of the different dashboard meetings. I think it's worth saying the COVID-19 dashboard wasn't every day exactly the same set of charts. It was a consistent set of data to help provide a baseline and a bedrock for ministers to have the Prime Minister to have a common understanding of where we were. But the data, we couldn't go through all the available data at every dashboard. So we highlighted different things. I'm afraid I haven't been back through all of them and exactly what we covered when. But the ONS data and other data was there alongside the dashboard and as available to everybody.
But the DHSC, I'm sure you agree, were producing their own long COVID dashboard, so the data was available. Do you agree?
Yes, there was data available. I do agree.
Yes. Thank you very much indeed, Mr. Ridley. Thank you, my lady.
Thank you, Mr. Metzer. Thank you very much, Mr. Ridley. Very grateful for your staying as long as you have done. We'll break now. I've been asked to take a break, and I shall return at 3:05.
I swear by Almighty God
that the evidence I shall give
shall be the truth, the whole truth, and nothing but the truth.
Sorry to have kept you waiting. Mr. O'Connell.
Could you give us your full name, please?
Edward Julian Udney Lister.
Thank you. Lord Lister, you had kindly provided for us a witness statement at our request, which you can see up on screen. I know you're familiar with the contents of that statement. It's signed on the last page. We don't need to bring it up underneath a statement of truth, indicating that the contents are true. Are you, in fact, satisfied that the contents of this statement are true?
Yes.
Thank you. At the start of your statement, Lord Lister, and in fact it's on the page that we're looking at now, you give us some detail as to your career, and of particular interest for present purposes, we can see from paragraph 3 that between July 2019, that is when Boris Johnson became Prime Minister in succession to Theresa May, is that right?
Yes.
So from that time until February 2021, you were a senior advisor to Mr. Johnson.
That's correct.
And within that period, initially from July 2019 until November 2020, you were what's described as his chief strategic advisor. And for the rest of that period, from November 2020 through until February 2021, you were his chief of staff. And that second period, did that second period start with Dominic Cummings leading Downing Street?
Yes. It basically started immediately he left.
Yes, thank you. And then, I think it's in this paragraph, or it may be another one, that you say after February 2021, so when you left that role of Chief of Staff, you became Mr. Johnson's special envoy to the Gulf, but only for a few months before you left government in April of 2021.
Yes.
Just briefly, before then, July 2019, so before you started your role at Downing Street, you describe having held a number of, first of all, commercial roles in the fire and security industry, and also, insofar as public service is concerned, you were leader of Wandsworth Council for a lengthy period between 1992 and 2011. Is that right?
Yes.
And then after that, Chief of Staff to the Mayor of London, that is Boris Johnson, and also a Deputy Mayor of London between 2011 and 2019. And that's a longer period, I think.
16.
2016.
Yes.
Right, well, that explains that discrepancy. And then a non-executive director at the Foreign Office between 2017 and 2019. So do we see then, Lord Lister, that you had in fact worked with, perhaps closely with, Boris Johnson for some considerable period of time before 2019? First of all in City Hall and then at the Foreign Office?
Yes, it was. I worked with him very closely while I was at City Hall, but then it was. I was more remote. But then I went back to helping him in the sort of spring of 2019 when he was running to become leader of the Conservative Party.
Yeah. Now the inquiry has now heard from quite a number of the people who worked closely with the Prime Minister during the pandemic. Some special advisors. Some civil servants. It would seem from the outline we've just seen that you may have been, of those people, the person who had worked with Boris Johnson for the longest period of time. Would that be fair?
I think so, yes. For all the people that are on the list, yes.
Can you give us, in a nutshell, what your working and personal relationship with him was like? For example, when you started working with him in 2019 in Downing Street?
I was in a unique position. I sat outside his office. I was somebody he would speak to quite regularly. I was able to go in and speak to him after meetings. I was in a position where he did use me to get information or wanted to sound off about things or to check on something. Look, I'd known the man for 10 years, so yes.
Is it fair to say, during that time you were in Downing Street before Dominic Cummings left, that you and he had a sort of shared or split responsibility in terms of policy coverage?
Yes.
We can see this described actually in paragraph 4 of your witness statement, which is on page 2. You say that as Chief Strategic Advisor, your areas of responsibility were foreign policy, security, defence and trade business, whereas Mr Cummings had responsibility for areas of domestic policy. Is that
yes.
In broad summary?
That was, in broad terms, the split between us.
You also say that your role included relations with Stormont, that's Northern Ireland, and also, I think, the Irish government itself.
Well, particularly during the period from July 2019 to December of 2019, while Brexit was underway, I was involved very directly in all the negotiations with the Irish government and with Stormont, which was at the time quite a difficult series of negotiations.
Yeah. I'm just going to read you a few sentences from Dominic Cummings' witness statement and see if you agree with what he said about the relationship that the two of you had to the Prime Minister. He said this: I was seen by the system as the PM's most senior political advisor in most ways, but it was also clear to some officials near the centre of power that on some matters the PM listened more to Lord Lister than to me, and that the PM gave Lord Lister things to do without always informing me. Fair summary?
Yes, I think that's probably right, yes.
How did you get on with Mr Cummings, Lord Lister?
We worked together. We had desks facing each other, so we knew each other. I can't say there was any close relationship. We were just work colleagues.
Let's move on, if we may, to the early stages of the pandemic. And for this, if we can go to paragraph 6 of your witness statement, which is on page 3. And if we can pick it up about 5 or 6 lines down, you say this: on the 27th of February 2020, I set out my concerns around the threat from Covid-19 from an economic standpoint, indicating that this was as important as the health issues and needed to be discussed in COBRA. And we can see, Lord Lister, what you meant by that and what you said if we go to a document which is 236371, please, and it's on page 47 of that document. I think this is the message that you're referring to in that part of the witness statement we looked at. And you see it's at the top here, dated the 27th of February. You say air freight rates in Asia up 500% and 4 days of drops on stock exchange. In my opinion, this is the real coronavirus threat. At best, or maybe you meant there, will be zero growth this year. Can I suggest that at COBRA on Monday, the economic bit is as important as the health input? Just to remind ourselves, we've heard a lot of evidence about the developing understanding of the virus. We're at the end of February here. Was this actually your view at the time, that the economic risk presented was as serious as the health risk?
I think in the context of that point in time, when we did not appreciate the true effect of COVID, and that evolved over the coming days, but at that point in time, we were not really aware of it. I was worried about the economic situation. I was worried that we were going to have a severe recession as a result of it. I was also concerned. I mean, we weren't talking about lockdowns or anything at that time. This was all pre that. And I was just concerned that the effect on the economy would be severe.
Were you concerned, perhaps it follows from what you said, that these economic risks were being either overlooked or at least downplayed?
I felt at that time that all the emphasis was on the health risk, which we were still trying to understand. And there wasn't enough balance about some of the other problems that were arising. And that yes, health was a serious problem. I mean, I don't think at that point anybody had died from coronavirus. It was still very early in the process. It was just a worry that everything was coming from health. All the lobbying of the Prime Minister was coming from one direction, and there wasn't enough of the counter-arguments being put on the table.
Do you think it's possible that in trying to redress the balance, which I think is what you're describing here, you may have been taken to, as it were, diminish the health arguments on the other side of the balance?
No, I don't think I ever diminished the health risks, because we could see that. And I think it was around then that we were, I think I do put it in a document somewhere, that we were starting to get a feel from China that it was becoming clear that the Chinese government was actually losing their efforts to contain the disease. And it was beginning to be clear that that was not succeeding. And I was, I think, just worried that it was a finely balanced issue. And I still believe it's a finely balanced issue all the way through. And yes, we may or may not go there in a minute, but yes, we go into lockdown. But the decision to go into lockdown is not an easy one. And there are conflicting issues which do need to be resolved and do need to be talked about.
Well, as you say, I'm going to come and ask you some separate questions about exactly that balance between the harms of lockdown and the benefits of it, both in terms of the first lockdown and later in the year. But just finally, still sticking in February for a moment, another theme of the evidence we've seen is that at around this time, Mr. Johnson was telling those around him that he thought what was happening was an overreaction, or at least that he was worried that there would be an overreaction to the pandemic. as it was developing. Is that a concern that, first of all, you heard him express, and secondly, that you shared at that stage?
Well, I certainly shared that view. I think he did express that as well. I mean, I think everybody was very worried that we were overreacting to something which at that stage we didn't believe was going to be as bad as it subsequently became. And certainly it was largely confined to China.
Let's move on just a little bit, Lord Lister. If we can go to page 10 of your statement, please. It's at paragraph 23. I just want to touch on the meetings that you describe attending regularly, and I think, sorry, we're on, yes, that's it. So I still want to be asking you about that early period in, let's say, February and March, but I think this paragraph applies to that time. You say that you attended a number of core meetings, meetings that we have heard something of from other witnesses, for example, the 8:30 and then 9:15 meetings, the 9:15 meeting being the one with the Prime Minister, COBRA meetings whenever the Prime Minister attended, cabinet meetings, and so on. And you say also, if we can look at the next paragraph, that you regarded those meetings as an effective basis for decision-making that was going on at the time. Just going back to the morning meetings for a moment, it's right, isn't it, that another of the regular attendees of those meetings in this period was Helen McNamara, the Deputy Cabinet Secretary. And you may have heard that her evidence about the atmosphere and discussion in the morning meetings during this period, so let's say February, March 2020, certainly the meetings that she attended, was that the atmosphere was, in her words, confident and macho. She said that wasn't a new thing, but that this atmosphere was, quotes, more so than usual. And she said the atmosphere was one of, quotes, we were going to be world-beating at conquering COVID-19 as well as everything else. Is that a description of those meetings that you recognise?
Well, I'm not so sure about the last statement you made. I don't recognise that. But yes, I think there was a great deal of confidence at that time that this was a disease. It wasn't going to be as serious as people made out. I mean, it wasn't that long before we'd had the whole of the SARS episode, which had largely stayed confined to the Far East. It hadn't really come into Europe. But we were fairly confident at that stage it wasn't going to come. And there was a concern that we didn't overreact to a problem, and that there was a lot of other things that needed to be done. It's worth remembering that by then we were only now some 2 months from a general election, 2 months from the Brexit date. There was a lot of other things on the agenda.
Lord Lister, confidence is one thing, but the effect of Helen McNamara's evidence was not that the mood at these meetings was confident, but rather that it was overconfident. That wasn't something that she was saying in hindsight. She describes being concerned about the overconfidence at the time. So is that something that you recognise?
I think what I recognise is that there was a belief that we had a health system that would be able to withstand it, that they had plans in place, it was well organised, it was well structured. And I don't want to jump forward too much, but it was only when we reached the Italian situation that it dawned on everybody that this wasn't like SARS in the Far East, this wasn't a relatively minor disease, this was serious. And so that was what, in the first week of March.
Yes. Well, let us move on to that period, only a week or so on from what we're discussing. If we can go, in fact, it's just a page or two back in your statement to page 8 and paragraph 21. So we say you're here describing a meeting in early March 2020, and approximately that is the time, isn't it, Lord Lister, when, amongst other things, it became apparent that the Italian, particularly in northern Italy, in Lombardy, that the health systems there were struggling to cope. We saw images on the news and so on of hospitals being overwhelmed. That was the time of this meeting, was it?
Yes. I mean, and what was particularly striking about it was that the Italian health system was generally regarded as a pretty good health system, as good as the UK one.
Yeah.
So we were looking at a country that was very similar to ourselves.
Helen McNamara said, amongst other things, that she remembered around that time in those morning meetings there being a sense that we would do better than the Italians, almost as though there was somehow a belief that they got it wrong, or that we would manage to not make the same mistakes as the Italians. Is that something you remember?
I'm not sure about that, but certainly I think yes, there was a feeling that we're going to do better than this. It's not going to be as bad as that. But I think we were still really in the position where we believed that the system had plans, that it would be able to cope with this. The health minister was confident. Everybody was confident.
Yes. Well, let's look at this paragraph. And for the first 5 or 6 lines of it, you essentially describe being briefed in a meeting in early March by Chris Whitty and Patrick Vallance about what we know and understand to be the mitigation strategy, the herd immunity strategy. And clearly you were given that information. And then 4 or 5 lines up from the bottom, you say, on or around the 12th of March, you recall the Cabinet Secretary advising the Prime Minister to explain to the public that the government's plan to combat COVID-19 was akin to chickenpox parties. Again, that's something we've heard about in other evidence, but it's something you remember, is it, that Mark Sedwill using that term?
Well, I remember it being said. I can't tell you which event or anything else now, but yes, it was made. But it was made in the context, and for people of my age, that was how, when we were young, that was how chickenpox was dealt with, and it was still a belief that COVID was something that herd immunity was the only answer. You needed to catch it quickly and get it over and done with.
Let's read on. Just the last few words of this page, and then we'll go to the next one. It was also in this context that the Prime Minister suggested to senior civil servants and advisers that he wanted to be injected with COVID-19 on television to demonstrate to the public that it did not pose a threat. And then you say that you appreciate on reflection that those were unhelpful comments, but they were made at a time of high stress and limited understanding of what lay ahead. Of course, you weren't able to know, neither was Mr. Johnson, everything that would develop over the following weeks and months, Lord Lister. But I just want to take you back to what you tell us that Mr. Johnson said, that he wanted to be injected with COVID-19 to demonstrate to the public that it didn't pose a threat. It did pose a threat, didn't it?
I've got to go back again. It was not a. We were. I'm a little bit uncertain of timings of some of these things, but it was before the Italian situation had really become apparent to everybody. It was a time when COVID was not seen as being the serious disease it subsequently became, or was seen to be. It was a moment in time. I think it was an unfortunate comment, but I think when you take it into context, out of context like now, and in the timing, it was just an unfortunate comment.
Well, I understand that's what how you regard it, Lord Lister, but I do want to press you a little. Do you think then that it wasn't necessarily made at the same time as the chickenpox parties?
I really am not sure. I cannot answer that question.
No. Well, even if it had been made sometime earlier, it had been known for many weeks by that stage, or it was known for many weeks before then, that COVID was a disease which would kill many of the people who caught it. So surely the Prime Minister wouldn't want to be telling the British public that it didn't pose a threat.
But I come back to, if I may, in answer to your question, this is not that dissimilar to the situation we'd had with things like SARS, where it had been a killer disease, but it had been a disease which had not transmitted itself to Europe. We had not reached us. And we were still living in the forlorn hope, as it turns out, that it wasn't going to come. That obviously was wrong.
There is a difference, but I mean, I don't think anyone injected themselves live on television with SARS, Lord Lister. Nor would they have been well advised to do so.
I fully accept it's a comment that shouldn't have been made, but it was made at the heat of a moment. That's all.
Do you think, whenever he made this comment, and obviously this is something we can ask him, but you've raised this, so I'd like your own view about this. Do you think that Mr. Johnson did actually think not only that the country was well equipped to deal with the disease and that there were systems and plans in place, but that actually even more fundamentally, it wasn't really a dangerous disease at all?
I do underline the point I made earlier. I'm not sure of the timing of these things, but my memory is that at that stage, it was not seen as the disease, the seriousness that it became apparent later on. We're right at the beginning of this. It hadn't really hit Europe. It was still very, very new.
Right. Let me move on with this and ask you some questions about another matter. And this relates to some of the early COBRA meetings that took place, in fact, in early March, and the question of whether the Mayor of London, Sadiq Khan, should or shouldn't have been invited to those meetings. We can start, in fact, on this page that we're looking at, which is convenient. If we could look at, that's it, paragraph 22, sub 2. You are recording here, and there's a list, is there not, of things that you know you did relating to COVID, which I imagine you took from an email review. You record here that on the 9th of March, the Mayor of London, that is Sadiq Khan, asked to attend, as we'll see, in fact, it was a particular COBRA meeting, and that you refused the request and suggested a meeting of mayors with Matt Hancock. I'd like to take you back in the chronology a little bit to explore what took place. And if we can start, please, by going to Sadiq Khan's witness statement, which is 221436, and page 16 of that statement. It'll come up on screen. We can see here that we'll remember that the date of your email, which you referred in your statement, was the 9th of March. So we've gone back a few days. And Mr. Khan says that he recalls that there was a COBRA meeting on the 2nd of March. He said it was about the 6th COBRA meeting, focusing on COVID-19. He hadn't been invited to attend any of the previous meetings. He asked his government relations team to contact number 10, requesting that he attend the 2nd of March meeting, given, as he said, that London was clearly one of the most at-risk places in the country due to its large number of airports and international travellers and high-density population. And if we very briefly just look at the paragraph above, we can see that on the same day he'd been told by Dr. Jenny Harris that 5 of the 35 confirmed cases in the UK, so 15% or thereabouts, were in fact from London. And just to follow from that, if we can go to a document, please, which relates to this exchange. It's 118937. Yes, thank you. So here we see, if we can look at the bottom half of the page first, an email sent on the 28th of February, which was the end of the week before the 2nd of March, from Sadiq Khan's team to Claire Brunton, which is a name we'll see several times in these exchanges, at number 10. And we see that this person contacts Claire Brunton and relays a request from the Mayor's Chief of Staff for the Mayor to attend the COBRA meeting on Monday, that was the 2nd of March, And we see, given its large number of airports, hospitals, international visitors, London is, of course, potentially one of the most at-risk places. Just pausing there, that would seem to be quite a good reason for the Mayor of London to attend Cobra.
Perhaps because I've been so involved with London government, and because I've also been involved heavily with the other local authorities up and down the country. Always at the back of my mind was the accusation which would come at the Mayor that he was treating London differently to the rest of the country. And my view was then, it stayed all the way through the COVID crisis, that you had to treat all parts of the country equally and give them the same kind of access as London. And if you, for 1 minute, allowed London in without inviting the others, there would be nothing but difficulty and problems.
Well, we'll come to see that that was why you stopped the Mayor attending a subsequent meeting. But one can see that that's a sensible, perhaps, starting point. But if one has a disease which is affecting London more immediately, or where the risk of the disease seems to be more focused or acute, really, is there some sort of prohibition on recognising the fact that the Mayor of London in that situation might be more deserving of a seat at Cobra than other regional mayors?
Yeah, but where do you draw the line on this? And also, I mean, as you said earlier, it was it was a large number in proportionate terms, but it was still a relatively small number in London. The rest were outside London. Where do you draw the line on this? The Mayor, the Prime Minister subsequently agreed to the Mayor coming about, I don't know, a week later. I'm sorry, you will have the
We'll come to it.
But my point is, it was always about parity with the rest of the country and treating all parts of the country in the same way.
Well, we can take this more quickly now. I mean, to be fair, your name doesn't appear on these emails. Can you tell us at this distance whether you were involved on this date or not?
Which one?
We're looking at the emails from the 28th of February, Lord Lister. We'll come to see the ones which bear your name a week or so later. It may not matter much, but do you know whether you were involved on this occasion?
I probably was, but I can't confirm 100%.
Well, but in any event, we see that what happened was that the message went back to say that the Mayor of London would not be invited to that Cobra meeting. Then we see, if we can go on to a different document, please, 214135. The same type of exchange on the 8th of March, so let's say a week or so later. If, in fact, we look at the email on the very bottom, again, there's a member of the Mayor's team emailing Claire Brunton, following reports that Cobra will meet again tomorrow, re the coronavirus. The Mayor's view is that he should attend this meeting, given the potential impact on London and Londoners. I know a request was declined for him to attend the previous meeting, that's the one we just looked at, but given the increased spread, we feel it's even more appropriate that he be there tomorrow. Can you let me know, please? And then if we go back to the page before, we see Claire Brunton, I think, contacting you, saying, I assume the answer is no again. You saying, if we just leave it without it being enlarged, we can just read up, I think. Then in the middle of the page, you saying, just underneath where it says on the 9th of March, you say no, but I do think there needs to be a meeting of mayors, perhaps with Matt Hancock. And then there's another email from Claire Brunton. These are all happening within a few minutes of each other, saying that the matter had been discussed at the 8:15 meeting, presumably without you, and that the general view from the room was that there is an argument for Sadiq Khan being at the meeting. And in response, a few minutes later, you say you can't have him there without Street, that's the Mayor of West Midlands, Andy Burnham et al. Or is London more important than Manchester? So this is the view you've just expressed.
Yes.
And we know that as a result of that, he wasn't invited to that meeting. Just one more time then, it really, is that sort of basic, you can either have all of them or none of them approach really appropriate at a time where there's a developing virus and there are perhaps good reasons to think it's affecting London more immediately, more seriously than other places?
Well, I did believe there should be regular meetings with the mayors, and that's something that should be taking place. But I did believe that to actually single out one authority over another would be a mistake. And
just to complete the story, if we can go back to Sadiq Khan's witness statement, so that's 221436. We can see, if we go to page 18, please, we can see, and we don't need to zoom in, we can just look briefly, we see that he refers, having been not invited on the 9th of March to Cobra, on the 11th of March, he had a meeting with Chris Whitty, then if we look on paragraph 77, about halfway down, he says, we had a wide-ranging discussion, that's him and Chris Whitty, covering the way in which the situation was thought likely to develop, noting that the highest concentration of cases in the country was in London, which was not surprising given the density of its population and status as a major transport hub. So in fact, Chris Whitty appears to be confirming the concerns that Sadiq Khan had earlier expressed. And then further down the page, we see that there was, in fact, a Cobra meeting the next day on the 12th of March. Again, he asked to attend. Again, he was told he could not. And next page, please. It's only the week after that, on the 16th of March, that Sadiq Khan was invited to Cobra for the first time. That's paragraph 82. So, Lord Lesser, just finally on this, on reflection, in hindsight, given that sequence of events and the documents we've looked at, do you think perhaps you or the system ought to have been readier to make an exception to that rule you described and invite Sadiq Khan, as in fact, as we can see, he was on the 16th, a week or so earlier?
And yes, and I think perhaps we should have moved, or I should have authorised it earlier. But I was always concerned about this treating London differently from the rest of the country. And in fact, later on in COVID, that became much more of an issue than it was at the beginning. But in hindsight, perhaps it would have been right to have done it earlier. But that worry was always at the back of my mind.
Yeah. Right. Well, I want to take you forward then in time, please. And let's talk about the first lockdown. And if we can start, please, on page 11 of your statement, paragraph 26. You state here that by the 23rd of March, it had become clear that a lockdown was needed to prevent the NHS from being overwhelmed, to buy us time until the vaccine was developed, and to underline the seriousness of the situation to the public. And I won't take you to it, but there's another paragraph of your statement where you state explicitly, perhaps it's implicit here, that you accepted and still accept that the first lockdown was justified at the time and in the circumstances that it was ordered.
I think what we believed at the beginning of March was that there was a plan that was there, that we could be used. There was the belief that herd immunity was the answer to the problem, and that the quicker we actually all caught it, the quicker we would have immunity from it, and that to some extent remained true, except, of course, that the death toll would have been unbelievably high and totally unacceptable. And therefore, it became absolutely clear that herd immunity was not a policy option that was open to the government, and that a lockdown was the only solution. But there were a lot of concerns about bringing the lockdown in. I mean, there was the worry about education, there was the worry about the economy. I mean, they were all there and they've all been spelt out. But it was felt that this was the only answer, and I go along with that. I think at that particular point in time, it was the right solution.
Thank you. And in fact, in the next paragraph of your witness statement, you give us a lengthy list, it goes on for several pages, of what you described as the key challenges the government faced at this time, by which I think you mean perhaps just before and then during
Yes.
The first lockdown. I wonder if I will pause at one or two of them, but if we just scroll through, we can see then what you regarded as being those key challenges: testing, social care, if we can go on to the next page, please, public health legislation, the devolved administrations. I'll come back and ask you some further questions about that. You mentioned the issue of PPE. We can go to the next page, please. We can just cast our eyes down. There's a series of issues there. Next page, please. And the next page. Then you've mentioned the closure of educational establishments as being one matter of particular concern, Lord Lister. Was that a factor which you regarded as being one which was considered as a reason not to lock down, or was it something that was a factor in terms of trying to unlock as quickly as possible?
It was more a question of trying to unlock as quickly as possible. I think I've said earlier in my statement that I believe that once it became obvious, and I think it became obvious once we started to see what was happening in Italy, lockdown was an inevitable outcome. But it wasn't a pain-free option. We knew that once you moved into lockdown, there would be other people who wanted to access health for other reasons who would not be able to. We knew that there would be problems with education, that the economy, and I can go on with all those things. But that had to be balanced against the terrible prospect of deaths, which was just an unacceptable position, and there was really no choice at that time. But what I was trying to do is trying to say that it wasn't a pain-free decision. It was right that government should try and see what the consequences of what they were doing was going to be.
Yes, and we've looked through that range of issues which you describe as being in play at the time, and we can look to the bottom of this page. It includes, of course, a factor you've already raised, which is retail and business. Is it fair to assume then that this list, which at its outset you were clear was not, as it were, an exhaustive list, but that this list were the types of issues that you recall being raised with the Prime Minister or those around him during this period?
Yes, they were all things that were discussed because there was a great deal of concern about all of those things, and there was an acceptance we had to go towards lockdown, and we would probably have to do lockdown, but there were going to be effects from that, which we needed to take into account and try and see if we could mitigate them. And I think I picked up there when I talk about testing. Testing wasn't an option. There was virtually no testing available, so we couldn't really test anybody. We were worried about social care and what was going to happen with social care. All of these things were issues that we were actively talking about and worrying about.
Last thing before I move on, it's a long list there. As I've said, you don't describe it as being an exhaustive list, but at least one issue which is notable by its absence is any question of the great increase in domestic abuse that took place once lockdown was ordered. Is that missing from the list because it wasn't considered, or can you tell us that it was?
No, it was certainly considered, but I'm not sure it was considered right at the start of lockdown. I don't think that was one that was particularly high on the list. I don't think people had thought about it as being a likely outcome from it. I mean, in hindsight, yes, it should have been, and it became an obvious discussion point later on. But by then we were in lockdown, and I'm still not sure what we could have done differently. If you're locking down, then you're locking down. That's one of the prices. I mean, there were all sorts of other things, like young people stuck in halls of residence miles away from home who couldn't come home because we'd closed the transport network down. There were lots of other things that were also happening at that time.
Just take you back to that, Lord Lister. Your very lengthy career in local politics at the national level, it's an odd thing to hear you say that there's nothing that one identifies a problem and then just shrugs on shoulders and says there's nothing.
Oh no,
to be done about it.
no, I'm not saying that. I'm sorry if I gave that impression. Then I unreservedly apologise for that. All I'm trying to say was that was not an issue right at day one when we were discussing lockdown. Lockdown was a very blunt instrument which was being used to try and stop the spread of COVID.
And
there were all sorts of consequences from that. Yes, we should have thought much more about domestic abuse. It just didn't. It wasn't discussed in my hearing until actually after we'd imposed lockdown.
Yes. So not foreseen, but if, it's right, isn't it, that once one recognises that there is a problem there,
Yes.
or for that matter, other similar problems with other vulnerable groups that are experiencing, let's say, a collateral impact of lockdown, there are lots of things that could be done to try and ameliorate the problem, aren't there?
Yes, and that was one of our worries. What do you do with this was never, sorry, the list in my statement wasn't designed as an exhaustive list of all the issues.
No, I hope I made that clear.
They were the number one issues, if I could put it that way, which were coming up. And we spent a lot of time going through them.
Let me move on, Lord Lister. As a later part of your statement, perhaps we can go to it. It's on page 16, paragraph 28. It's about 5 lines down. Can you see where you say, in my view, the first lockdown continued for longer than I believe was necessary? Can you help us to understand that a statement, please? Why do you think that? And is there a particular period that you think was inappropriate or that steps were not taken quickly enough in a more general sense to lift the lockdown?
The concern was, as lockdown continued, the consequences of it were becoming more and more difficult. The concern about the economy was enormous. Business wasn't flowing. I mean, if I take a very simple example, for example, sale of cars. How do you keep car factories going if you can't sell the car that's being produced? Therefore, you've got no alternative but to end up leading to letting people go. And there were all sorts of problems. And by then, the early part of lockdown, everybody understood there was no choice. But as lockdown proceeded, it became more and more difficult to keep these things going. And indeed, we started to relax things. We started to relax things like garden centres and other things, large places. But the pressure from the public was enormous by then to open up. And that stayed there until the summer when we did open right up.
Pressure from the public, perhaps, but you seem to be expressing here your own view that things should have been done differently.
My own view was that we needed to look at releasing the economy as quickly as possible, and that the quicker we could do that, the better. That was always my view. And once we started to see the numbers starting to improve, and look, please, it sounds very cruel and hard. Every death is a terrible thing, and I'm not for 1 minute arguing that it isn't. But I am arguing you have to balance it all the time, and that the pressures on the economy were enormous by then, and the pressures from people, from business, everybody.
Let's look at another document, if we can, and that is an email. In fact, it's from Stuart Glassborough, who the inquiry heard from yesterday. Yeah, that's it. I know you're familiar with this email, Lord Lister. At the bottom of this email is a readout, a summary, is it not, by Stuart Glassborough, who, as we recall, was the Prime Minister's deputy personal private secretary, a readout of a meeting that had taken place between Mr Johnson and the Chancellor, and he is sending that readout to you. And we see that in the meeting that he's describing, there had been a discussion between the Prime Minister and the Chancellor, where, as we see from the very first couple of lines of the main paragraph, the Chancellor reiterated the implications for the economy of the current lockdown measures if they persisted. And then I won't read the rest out, but we see that the theme is similar to the one you were just describing, the Chancellor, in summary, urging greater progress on opening the economy up. And we see further up the page you asking to be involved in a follow-up meeting. Is this a fair reflection of what was happening at the time? Do you recall the Chancellor really taking up that cause that you've just been describing and urging the Prime Minister to move faster, opening up the economy?
I don't think it was just the Chancellor. I think it was really anybody who was looking at the economic factors that were at play at that point in time. There was also pressure from other sectors to open up. It was beginning to be worrying about what was happening to the economy. And there was a constant stream of messages coming back from various industries that they were going to have to start letting people go, close down. They were running out of money, and it was at this time that various subsidies were being put into various places to keep things going.
It's hardly surprising, in one sense, that the Chancellor of the Exchequer is advocating within government for government to take steps to protect the economy. After all, that's, you might think, his job. But in this particular context, where there is a pandemic afoot, and a balance to be struck between health risks, as we've been discussing, and damage to the economy. Did you understand the Chancellor's role to be simply advocating for that economic side of the argument, or did you think that he was himself trying to come up with his own assessment of the balance between health risks and economic damage?
I don't think I'm really sure on the answer to that one. Certainly, as you quite rightly say, it was his job to represent the economy. It was my job, as part of my role in Number 10, to also represent business as well, all of whom were pushing hard for some relaxation because of the consequences of this. I think the rest of that you'll have to ask the Chancellor.
Well, we will, but I'm still interested in your understanding of the dynamic at the time, because we've heard some evidence that some of the scientists involved in SAGE and so on took the view that the Chancellor was striking the wrong balance in this period and arguing too forcefully for economic matters and causing a risk. And in fact, we heard yesterday some evidence that the Prime Minister himself referred to what was described as pro-death squads from the Treasury. One doesn't, of course, want to put too much weight on a few words, but what I want to ask you, with your experience and presence there at the time, is what was the understanding? Was the Chancellor perceived as someone who was simply advocating at every step for the economy, or was there a feeling that he was trying and, in some eyes, failing to strike the right balance between economic risk and health concerns?
I think everybody was trying to strike that balance, and I think it was a situation where you either erred a little bit more on the economic argument or you erred more on the health argument. I mean, it could be argued if you like, that the health representatives who attended the various meetings with the Prime Minister, I don't think we would have ever come out of lockdown that summer. They would have kept us there, even though the data was showing a marked improvement in the situation. And therefore, this was a sort of constant discussion that was taking place. Arguments are, I think, too strong a word. It was a discussion that was going on all the time.
With the Prime Minister right at the centre of it.
Yes.
And as we've seen earlier today, having to make some extremely difficult decisions.
Yes.
Before we move on, I just want to ask you one more thing about this document. If we can look at the very bottom of this page, and it'll mean we go over onto the next page. The PM and Chancellor agreed on the need to undertake measures that would power the economy, giving the best shot at as full and fast a bounce back as possible. This would likely focus on supply side reform, e.g. on planning. Well, this is in May. It wasn't that much later, was it, that the Eat Out to Help Out scheme was introduced? Not about planning, but fairly described as something on the supply side of the economy.
I think that's, by the way, where that thinking was predominantly.
Yeah. Were you involved in the Eat Out to Help Out scheme?
No, I was aware of it. I was aware of the thinking behind it. I was aware of the discussions about the changes to the VAT rules and what they would do to try and kickstart the hospitality industry. And it was the hospitality industry, above all other industries, that was the one that was most affected. It was there that the greatest number of company closures was taking place. People were losing their jobs. It was that part of the economy which was more seriously affected than any other part.
You weren't involved directly, from what you say, in the Eat Out to Help Out scheme, but again, given your experience and presence there in Downing Street at the time, would you have expected that scheme to have been developed in a way that calibrated the risk to health against the benefit that was sought to be achieved to the hospitality industry?
But if I may answer that, I mean, I'm now struggling to remember the numbers. I think it was at that time you could have no more than 6 once we did open up. It might have been 4. I can't remember now the number. But there was a limit on the number of people that could gather together. So it was quite small groupings that were to be allowed. There was the 2-metre rule that was in place. These were things that were designed to try and make that as safe an opening as possible.
Well, doesn't that rather beg the question, Lord Lister? Because one way of doing that sort of calibration that I suggest would be by a non-scientist like you, with respect, to undertake the sort of exercise you've just undertaken, to say, well, you know, there's not many people sitting around a table, and there aren't going to be that many tables, so it'll probably be safe.
No, that whole policy piece about the design of the rule of 6 and the how far people should be apart was something that was set up following discussion, advice with medical professionals. It wasn't somebody like me sitting around a table who came up with a rule of 6.
Well, I want to go back to Eat Out to Help Out, because one obvious way of ensuring that scheme struck the right balance, or at least understanding what balance it did in fact strike between economics and health, would be to have asked SAGE, which was after all the committee that had as its function providing expert epidemiological health advice to the government. And the evidence that we've heard was that SAGE was not consulted about the Eat Out to Help Out scheme. Would you have expected that to take place?
I can't answer whether SAGE was or was not consulted, but what I can say is that all of this was discussed at the 9:15 meetings. There was the Secretary of State for Health present, there were medical advisors present. All of it was done in discussion with those various people, and at the end of the day, the Prime Minister, in conjunction with his colleagues in the Cabinet, made the decision.
Just one more issue before we move on, and it's still on this question of striking the right balance and ultimately following this discussion that you've described, the Prime Minister having to make what in many cases were very difficult decisions. Are you able to help us a little bit more with the dynamics of all of this between the Prime Minister and the Chancellor? We've heard this afternoon, in fact, that later in the year, so in the autumn, where these discussions, and we'll come on to talk about this ourselves, came back with a vengeance. There was a perception that the Prime Minister would make a decision, shall we say, favouring the health side of the argument, only for that decision then to be, and the word used was, undone by the Chancellor, who would have another go at him and persuade him to change his mind. Is that something that you recognise?
What I recognised from that was that the Prime Minister was dealing with a series of... there were no easy decisions here. Everything was a balance, and it was a very difficult balance to strike. And I think that at the various meetings there were different lobbies that were at play, the health lobby, some of the other ministers were pro-lockdown, others were wanting to open up. That was taking place all the time. So he was trying to steer a path through the middle of this, to the best of his ability, and listening to the advice being given to him on both the economy and from the health professionals.
But were there occasions where it appeared that he'd made one decision and then one group or the other had a further meeting with him or discussion with him and he then changed his mind?
Well, any decision that he did change his mind on wouldn't have been a decision that had been finalised by Cabinet or any other group. It would have been in discussions with his various advisers around the table. And I think that was more him weighing up the different options that were in front of him.
Let me move on, Lord Lister, and I'm moving forward now, perhaps a little further in the year. We're still in the summer of 2020. And the evidence the inquiry has heard about the culture of the working environment in Downing Street and Cabinet Office at the time is striking, and I'm sure you're familiar with what the inquiry has been heard. We've seen the paper that was written by Helen McNamara and Martin Reynolds on that very issue. Do you think you saw that paper at the time?
Yes.
I'm not going to take you to it, but we will recall that summary superhero bun fight, junior women being talked over or ignored, various different aspects of an unhappy staff culture. You were right at the centre at the time. What insight can you provide us with about all of that?
I think there was a real tension at play at that time. I think it was largely driven by personalities. There were people there who were quite difficult to deal with. And I think there was a lot of tension that was taking place. I think that there wasn't enough weight given to the view of some of the different people around the table. More weight should have been given than there was. But it was quite difficult to deal with it. There was a problem with, and I mean, you've heard from Dominic Cummings, you've heard other evidence. I mean, he was not an easy man to deal with. And that was a tension.
Sorry, just to interrupt you. When you say he was not an easy man to deal with, you mean Mr. Cummings?
Yes.
Well, sorry, having interrupted you, let me ask you another question. You had worked with Mr. Johnson, as we saw, for many years by this stage, including somewhere completely different, City Hall, for some time. And, well, there is a general understanding, I think, that Mr. Johnson creates or enjoys a perhaps slightly chaotic working environment. I think it's clear that what was being described in the Reynolds-McNamara paper was something quite a lot more than that. Was there any comparison between the working environment in the Cabinet Office in the summer of 2020 and other places that you had worked with Mr. Johnson? I suppose what I'm trying to ask you is, do you think Mr. Johnson's sort of influence is part of the explanation for all this, or was it the very particular circumstances related to that place at that time?
It was not like that when I worked for him in City Hall. I don't think anybody would ever suggest it was. There were better working relationships between the individuals, and I certainly have no memory of any one group being talked over. I think that was a feature of Downing Street. I think it was. It's partly, I think, the tensions and the pressures of the place, which are enormous, and there's also a certain amount of this about people being very, very tired. The working day in Downing Street is sort of 8 till 8 plus weekends. That's the norm for anybody who's working at the centre of it. So it's hardly surprising tensions do run high. I'm not saying that's acceptable. I think that it would have been better if the Prime Minister had dealt with it, perhaps when the opportunity occurred to him certainly in the July of 2020, if not earlier. But he should have. There was a personality clash that was constantly going on, and there was an atmosphere.
Can I just take you to one WhatsApp reference which gives us some insight into your role, fairly limited role in all of this? Yes, that's the right page. This is, to be clear, an exchange between Simon Case and Mark Sedwill. You don't seem to have received or contributed to these messages, but you are mentioned in them. And we can see that on the 2nd of July, so that's a couple of months after the paper from Helen McNamara and Martin Reynolds, Simon Case, who at this stage has recently come to Downing Street, or the Cabinet Office, says, "At this rate, I'll struggle to last 6 months. These people are so mad, not poisonous towards me yet, but they're justly mad, self-defeating. Sorry, they're just madly self-defeating." Mark Sedwill says he'll fix. And then, yeah, you're okay so far because you've been around for the good news phase. Wait until there are more Leicesters and then the fur will fly. Watch yourself. And Mark Sedwill says, as I pointed out to Eddie, and that's you, I take it, it's hard to ask people to march, I think he meant, to the sound of gunfire if they're shot in the back. And Simon Case says, I've never seen a bunch of people less well equipped to run a country. PM asked me today who will replace Shinner when he goes. I was quite direct in telling him that lots of the top drawer people I'd asked had refused to come because of the toxic reputation of his operation. What these two very senior officials seem to be discussing between themselves, and also on this basis discussing with you, is a very extreme set of affairs. Not just some personality clashes, but the sort of toxic culture which seems, as we can see from the last entry, in fact to be discouraging others from wanting to go and work in the Cabinet Office. Is that a fair reflection of how you saw things at the time?
Yes.
Do you remember Mark Sedwill having that particular conversation with you? Or
not particularly, but I remember, well, not those words, but I do remember similar conversations. We did speak together quite a bit about the need for change, and that it would have been easier if there was a change in the regime. There were two problems. One was too much power was being taken to Downing Street because of the frustrations of things not being done elsewhere, and in fact it wasn't the right answer to bring it to the centre. It should have been left in the departments, and whatever the problem was, corrected within the department. But also it was because some of the personalities just made it very, very toxic. In fact, I mean, I'm jumping around the bush a little bit. I mean, I think the problem by then was that Dominic Cummings' relationship with other people had become very strained.
You remained in Downing Street for about another 8 or 9 months after this. Did the position carry on as bad as it's described here, or did it improve particularly perhaps when
it started to improve really after during the summer and afterwards. It got a lot better. I think because there wasn't quite the same drama and tension that there had been in the first lockdown, but also I think because the personalities had slightly started to change and people had moved on a little bit, and that I just think it got easier to deal with the problems.
Thank you. Let me go to another topic, which is your involvement in relations between the government in London and the devolved administrations. Of course, I mean, the inquiry has heard a fair amount of evidence now on that issue. We saw right at the start of your evidence that prior to the pandemic, one of your areas of responsibility had been overseeing relations between the UK and Ireland in the context of the Brexit negotiations. Did you have a role once the pandemic started in liaising with the devolved administrations about the measures that were taken to combat the pandemic?
I had a role in so much that we had regular meetings with the devolved administrations. I was able to make calls to various people and did do at various times because of issues that arose. So yes, I was involved.
You referred in your witness statement, I don't think we need to go there, we can if we need to what you describe as 4 nation forums. Were those the same things as the regular telephone calls or perhaps Zoom calls that Michael Gove had with the leaders of the devolved?
Michael Gove had the more formal meetings, but there were quite regular discussions which the Prime Minister was involved with when various issues were at various points during the COVID pandemic. There were these calls, these regular Zoom calls, which took place between the leaders.
So you're not referring to any special or
No, there was. I mean,
just
the Four Nation Forum, I think, was the formal name of the ministerial group, which was led by Michael Gove.
We'll come to one or two particular issues, but in general terms, what was your take on the state of relations during this emergency between London and the devolved authorities, the devolved administrations?
I think they went very smoothly, or relatively smoothly. Nothing went smoothly, but relatively smoothly with Northern Ireland and with Wales, and it was very tense with Scotland.
Well, let me explore that by moving on in the chronology, because the evidence the inquiry has heard is that as 2020 passed, and in particular once in the summer of 2020, the lockdown step by step was lifted, that was the point at which the policies that were being pursued in England and in the devolved nations started to diverge, and it was a consequence of that divergence that there were tensions developed between the diverged nations, and in particular calls made by Mark Drakeford and Nicola Sturgeon, at least, for there to be more sort of centralised decision-making, calls for COBRA meetings or a joint ministerial council to be held. Is that a fair summary? Do you recognise that description of how the relations went?
Yes.
We've also heard that Boris Johnson was opposed to what he described as it were, federal decision-making. He felt that it would be wrong, and I'm paraphrasing as part of his witness statement, wrong for, as it were, himself and the leaders of the devolved nations to meet together to decide on measures. Rather, he should simply decide what should happen, and the devolved nations should be informed and attempts made to accommodate them. Again, have we got that right? And what were your views about that issue?
I think the Prime Minister felt very strongly there needed to be one UK message being pushed out. And there were various disputes particularly with Scotland, over some of that messaging. There was an issue that pretty much each step of the lockdown release required some change to rules or regulations in one form or another. And to try and get agreement amongst all the devolved authorities was very difficult. By and large, Wales and Northern Ireland went along with with Britain, with England, maybe with some small modifications or changes, or maybe they influenced those and their changes could be incorporated. But with Scotland, it was always that whatever the announcement was, Scotland wanted to do it a day or two earlier than England, or a week later, or it never wanted to do it at the same time. And that created a great deal of distrust within the organisation and a lot of frustration.
The starting point, perhaps, is that health was a devolved issue in each of the devolved nations. So they were entitled, more than entitled, they were under a duty to make their own decisions on health issues within the different nations. I mean, that must be right.
That's right. And in each of them, there was a chief medical officer, and the chief medical officer for England, Chris Whitty, used to have regular meetings with his opposite numbers, the chief medical officers of those devolved administrations. That, I think, all worked pretty smoothly and pretty straightforwardly. It was the politics that was always the problem. And it seemed to us in Downing Street that it didn't matter what the decision was. Scotland would always want to do it slightly differently to England.
Let me take you to the part of your witness statement that you where you draw attention to this point. Yes, thank you. It's Little Roman 4. And we can see here, you say that the cooperation was less effective in the case of the Scottish administration, and then, as you say, keen to announce measures either before or after the rest of the UK. And then this, for reasons which appeared more political than data-driven. Well, the Scottish administration did have the political authority and duty to make those decisions. So what do you mean by political in that paragraph?
I think there was a real desire by the Scottish government to always show that they were not doing the same as England, and that they were running a different operation in Scotland, and that they were, in their view, doing things better. It was just, but it almost seemed as that there was a desire just to be different.
Opportunistic?
I think that's a good word.
And it's implicit in everything that you've said that this was a source of frustration in Downing Street.
It was a frustration. It was just, look, you're making a decision at a COBRA meeting or whatever to change a rule, and then you find out that the change has just been done in Scotland the day before or 3 days later. And then there were also arguments about some of the messaging that had to be put out. It just caused confusion.
Was this sense of frustration one of the reasons why Boris Johnson was reluctant to meet the leaders of the devolved administrations?
Well, he largely used Michael Gove for those meetings,
yes.
And he delegated that responsibility to Michael Gove to do that.
Well, quite. So he as I said, that we've seen evidence that, in particular, Mark Drakeford, in the autumn of 2020, called for there to be meetings, a JMC or a COBRA meeting on different occasions. And the answer, at least on occasions, was, well, no, we won't have a meeting of the heads of the government, but Michael Gove will meet with you on a Zoom call. That's what I mean by perhaps reluctance of Mr. Johnson to engage in that type of meeting. Do you think that this sense of frustration could have been one cause of that?
Yes. I mean, I think there was a constant feeling by him that whatever he was going to say, they were going to play politics with it and do something slightly different. And that was what happened time after time.
You referred, Lord Lister, to messaging, communications, and there's a document just pause there before I take you to the document. Yes, let's go to the document. We've got it here. In fact, it's a document the inquiry has seen before. But it dates from May 2020, so again, when sort of around the time of the first lockdown being lifted. And in summary, I know you've seen this document before, there was a request, was there not, from the Scottish Government that the new Stay Alert campaign, which was being used in replacement for the old Stay at Home campaign, shouldn't be used in Scotland because it didn't reflect the policies being pursued by the Scottish Government. And if we read to the bottom of the numbered points, ultimately the recommendation was that the Scottish Government's request should not be met, that the campaign should be run nationwide, and I think we've heard from an earlier witness that that's what happened. Wasn't the Scottish Government, with its devolved responsibility for health, entitled to ask the London Government not to broadcast a campaign in Scotland that didn't reflect Scottish Government policy?
I think this was the argument, that it was just causing confusion with too many different messages going out to people. It was hard enough trying to have one coherent message going out all the time. And the general view was it was essential to stick to one message. And that was clearer, easier and better to do that.
But doesn't that reasoning simply not meet the point that in this area of health, under the devolution settlement, it was for the Scottish Government to decide how the pandemic was going to be tackled in Scotland?
Yeah, but when you've got national newspapers, national television stations, national things, you can't suddenly start having different messages. The same adverts were going out on television right across the country.
Well, one way of addressing this, which has been mentioned in evidence, is that at press conferences, as you say, which clearly were going out across the UK, the Prime Minister should make it clear, if necessary, that certain measures or certain campaigns didn't apply to Scotland. But more fundamentally than that, given the devolved responsibility of the devolved administrations, if the English campaign wasn't something that they were happy with, wasn't that a reason not to run the campaign at all?
But you can't not run campaigns through the course of the pandemic. There was a series of campaigns being run in newspapers, on television, and there was a very strong view coming from the media side at Number 10 was that you had to have one simple message that goes to everybody.
And the person to decide on that one simple message was Boris Johnson.
Well, he's the Prime Minister.
He's the Prime Minister of a country, parts of which had their own responsibility for health.
He also had a very clear responsibility about the pandemic to do the best he could for the whole country. And that was the view he took. Although I've got to say to you, I think most of this was really discussed within the media operations of the Cabinet Office and Number 10.
Looking back on it, clearly there was conflict, tension. Your understanding that there was a certain amount of political game playing. Do you think if the governments of the four nations had tried harder to work together and settle their differences, that some of these problems could have been overcome?
I've got to say, I think that actually the Prime Minister at the Cobra meetings and the meetings that Michael Gove had, everybody tried very hard to have coherent messages and to work together. It was just difficult with Scotland. I don't remember any disputes, not major ones, with Wales or Northern Ireland, or disputes which weren't resolved relatively amicably.
So I'm going to move on to the last of the topics I have questions for you about, and that's the...
Can I just ask roughly how long? I'm not pinning you down, it's just I've been asked to take a break, but if it's not going to be that, I know Ms Mitchell's got some questions.
Yes. Well, it's not going to be a couple of minutes, it's going to be probably maybe 10 or 15.
Well, I'll take a 4-minute break. Mr. O'Connell.
Great from Lady. Lord Lister, I'm going to move on to, as I said, my last area, which is to ask you some questions about things that took place in the autumn and winter of 2020 going over into 2021. In fact, the inquiry has heard from Mr. Ridley that today a fair amount of evidence about that period. We know, of course, infection rates started to rise at the end of the summer and into the autumn. There were calls from SAGE and others for a so-called circuit breaker lockdown from September. That's the context. And if we could look, please, at paragraph 32 of your witness statement, which is on page 17. You make very much the same point. The R number was rising in September 2020, the proposal for the circuit breaker. However, you say the opposition to any form of lockdown was intense. And then this, you recall the PM saying in September 2020 that he would rather, quote, let the bodies pile high than impose another lockdown. And you go on to say it's an unfortunate turn of phrase. Can you help us with the occasion on which the Prime Minister said this, or to whom he said it?
No, I can't. I can't recall. I mean, it was at one of the many meetings that were going on. I can't tell you which one.
No. What did you take him to mean by it?
I think it was just we'd had the summer. Hospitality had opened up. There was immense pressure to keep the economy moving forward, and the R number was starting to rise, particularly in the north of England. And this was beginning to lead to quite a few pressures from the Department of Health and from the Health Secretary for a lockdown to be put in place as soon as possible. And this was the debate that was going on. Do you now lock down, or do you keep going? By now we were starting to see vaccines coming through. Things were starting to look a bit brighter than they had been earlier.
In terms of vaccines?
Well, no, generally things were looking brighter than they had been in the first lockdown. There was a feeling that could we hold off? Could we find an alternative to locking down? And it was also that the R number, although it was rising, was not rising at the same rate in all parts of the country.
We'll come on to the tiers shortly, but just before we leave this, it's one thing to have a debate about locking down or not locking down. Of course, issues between the harm that a lockdown would do and the health risks that might seem to indicate a lockdown is needed. But to say that let the bodies pile high is a very striking term.
I think, Mr. O'Connor, that's a question for the former Prime Minister rather than Lord.
I'll move on,
Lister.
Lord Lister, to ask you about the tier system. As you say, and in fact, if we move to paragraph 33 of your witness statement, we see you make the point that the R number was not the same in different parts of the country, and it was in October of 2020, was it not, that this tier system was introduced, and you played quite a significant part in trying to implement it. Is that right?
Yes.
And what was your role?
My role was to try and get an agreement in the different parts of the country where the R number was going up to basically establish a tiering system, tier 1, tier 2, tier 3 basically being total lockdown. And it was an attempt to try and find an alternative to a national lockdown, and therefore do it on a regional basis and try and keep the economy, as much of it as we could, moving forward.
You say you were negotiating or trying to make agreements with the local authorities. Perhaps it's obvious, but presumably it was with those authorities and the regions where that were proposed to be put into the higher tiers that the discussion needed to be had.
Yeah, basically the number was rising, particularly in the north. There was some movement in the Midlands, but it was mainly a northern phenomenon at that point in time. Later it changed again, but at that moment It was particularly high in areas like the Northwest, and that's why we started the negotiations in Warrington, we started in Liverpool. It was those areas that were seen as being the ones with the highest threat at that time.
And we've heard about Liverpool and Manchester, but just give us an idea. Were there in fact quite a number of different regions, a number of different negotiations underway?
Yes, I mean basically the whole of the North and the Midlands was subject to different negotiations underway. I mean in the Northwest, for example, there was one going on with the Lancashire authorities, which was a group of authorities. In Manchester, it was the Metro Mayor. In Merseyside, it was a Metro Mayor. In Warrington, we had another one, and we had one in Cheshire. So, I mean, we had different negotiations there, and then that was reflected right across the North East and the North generally.
We've heard, in fact, from Mr. Ridley this afternoon, his views about the tiering system. And perhaps his fundamental view was that because of circumstance, which we'll come on to, it wasn't given long enough to prove itself or not. But he did also identify a number of built-in problems with the tiering system. And one of them we've just really been talking about, which is that it necessarily involves a series of negotiations with quite a large number of different authorities, which experience proved were difficult and lengthy. On that, were there to be another situation in which a system like this was envisaged, do you think that the necessity to have all these different negotiations with different authorities is a reason in itself to mean that a tiering system is simply unachievable or not?
I think we try to bring in the tiering system by agreement with each of the authorities. And the problem was that each one wanted to try and get a bit more money than the last one. So the negotiations were by their very nature difficult. And one of the things that I did do right at the beginning of the negotiations was to assure anybody that we did a deal with that if later on with some other authority we'd come to something slightly different, that retrospectively that would apply to them. So nobody was going to lose out. But it was tense and was difficult. The local authorities did not want to close their hospitality industry down. It had only just started to get back on its feet. There was immense opposition to it. And the problem with it was we were trying to do it on a regional basis, which I think was right. It was the only thing we could do. But of course, within a region, things weren't always the same. I mean, good example, Manchester. I mean, the high R number there was in Bolton. That was our biggest problem, while Stockport had a very low R number. But that was just within one region. But we were trying to impose a tiering system which would be for all of Manchester or all of Merseyside. So it was messy, but I think it was the right thing to do. And I think we, by and large, got agreement to most of it by most authorities. And I think if we kept it going, I believe it would have worked, but in the end, there was a decision taken just before Christmas to bring in a circuit breaker and to stop it.
Yes. Let me just ask you about one other of the problems identified by Mr. Ridley. It really follows from what you've just been saying, but quite apart from, he said, the difficulty of the negotiations, one ended up with an incredibly complex situation with a whole series of different regions, different rules applying in different regions, the need to draft different regulations for different regions, and then all the confusion on the ground that stemmed from that. Again, do you think that those were the types of problems which, in the end, could have been overcome and perhaps in the future, in another pandemic, could be?
I would like to think we could overcome them. I think we were starting to overcome them. I think we'd got a coherent set of regulations. I mean, once we'd done the first couple, the rest were largely copies of those regulations. Yes, there was a bit of confusion. You know, why was Manchester different from Merseyside or wherever? But by and large, I think the local people understood what was going on in their communities, and it was a price worth paying to try and keep their economy open. and that was seen as valuable and worthwhile.
Thank you. Now, as you say, the experiment with the tiering system, in fact, only lasted a month or so, or even less, because the second lockdown was introduced at the beginning of November. And then, as we know, in January, there was a third lockdown introduced after Christmas. You have expressed a view in your statement in a number of paragraphs that you didn't think that either of those two lockdowns should have been imposed.
I believe that the tiering system was going to work. I think that it wasn't given long enough. I think we could have got through to the other side of Christmas without the circuit breaker. I also believe that by the time we did bring in the final lockdown, by then I just think the tiering system wasn't given enough time or enough of a chance to succeed.
You also mentioned at various places the vaccines, but you mentioned them, I think, in relation to both the second and the third lockdown. But in fact, the vaccines didn't really get going until into the new year, did they? So at least at the time those two lockdowns were introduced, they weren't really a feature.
No, they were just being started. We'd started with relatively low numbers in the early autumn, and it was being ramped up pretty steadily through into the new year when it was really beginning to then become a major factor. But we knew the vaccine was there. We knew it was coming, and there was a feeling that with local tiering, and if the R number went up sufficiently high, we would close down that area completely, which was the plan. I still think that could have worked, but it wasn't to be.
No. I think the last point, Lord Lister, can we look please at paragraph 37 of your statement on page 18? This is one of the passages where you're expressing the view that in this case, the second lockdown should not have taken place. But I want to ask you about a sentence about 6 or 7 lines down, where you say there was no evidence that young people were badly affected by COVID, but the argument was that it was necessary to protect their parents and grandparents and so on. By the end of 2020, it was clear, wasn't it, that long COVID could and did cause serious illness in young people. Is that fair?
I'm not sure. I think it was later than that when long COVID became the issue it became. I think it was still not really understood at that point in time. It certainly wasn't a major factor in the autumn of 2020. It certainly was by 2021, but I don't remember it in the autumn.
Yes. Well, I don't want to spend time going over the details. In fact, what's perhaps more important is your own understanding. But so we know, for example, that there had been some Department for Health sponsored meetings and so on in the summer and the early autumn of 2020. But was your position doing the best you can from, let's say, October, November 2020? Help us. Were you thinking of long COVID as a factor at that stage or not?
No. I was much more concerned about the economic effects of lockdown. I suppose it was inevitable because I was spending all my time talking to leaders of local authorities. I was very much involved about what was happening in those local authorities, about the need to get the economy moving, the worry they had about people losing jobs, all of that. So for me, that was the priority. And I was very much involved in trying to do that. And I had to, it's worth just making the point, those negotiations were not one way. It was a two-way negotiation because I was also negotiating with the Treasury. Because the sums of money had to be agreed. So it was quite a complex period. Yes. But I still believe that, we'll never know, but I do think the tiering could have been given more of a chance.
Just sticking with this and long COVID, just for another question or so. Of course, we know that around this time, it was the time of the Great Barrington Declaration, We've seen references in some of the Prime Minister's documents to him worrying about the QALY issue and the age of COVID victims and so on. And so there was very much part of the debate that lockdowns were having a disproportionate impact on young people. One point to make in that regard is the one I've made to you, that long COVID did have an effect on young people. But can you remember that being raised as an issue in your discussions, either in terms of the second
No, not
lockdown?
particularly. I mean, I think the main issue that was coming up with young people was always the issue about school closures and the need to get schools back.
Yes. Well, thank you very much, Lord Lister. Those are all my questions. There is one set of questions from core participants.
Ms Mitchell.
Thank you, my lady. I appear as instructed by Amar Anwar on behalf of the Scottish COVID bereaved. Lord Lister, I'm going to ask you to look at an email communication which you were involved in, and can I ask that inquiry number document 000214-134 is placed up on the screen. And can we scroll down to the bottom, please? Do we see here that a question is being asked that the FM is looking to have a call with the Prime Minister to discuss COVID-19 further, and a question is being made about availability? Can we scroll up from that? And if we can zoom in on the response to that, I think in blue. Becca's asking, and I think this includes you as you respond to it, "Hi all, what do you think of this? I think it would be near impossible to reject this request given the subject matter. I can ask for more info on what it's about specifically first, and then can we see your response to that?" And I think your response there is no choice but to do it, Ed. Firstly, I'd like to ask you, were you aware of any attempts by the Scottish Government to discuss COVID with the Prime Minister prior to this occasion?
I have no memory of that. I'm sorry, I think I've got to say I'm not sure.
We see from that line of communication that the word further is used, tending to indicate that there must have been some earlier communication. Would you agree?
Yes.
If we can orientate ourselves at this time, this was, I think, the 5th that the request was made, the 5th of March, and that was on the date COVID-19 was added to the list of notifiable diseases. From the text of this email chain, it appears that there's a reluctance to have the First Minister in contact with the Prime Minister. What was the reason for that reluctance?
Well, I mean, as you can see from the exchange of emails, the meeting took place. I certainly wasn't trying to block that meeting taking place, but there was quite a lot of tension between the Prime Minister and the First Minister. They had no real personal relationship of any kind, other than that they, I think, generally didn't like each other very much.
But surely, given the nature of what was being discussed and the timing of the call, it would have been important for that to have taken place, regardless of any views held personally.
Yeah, and you will see from this exchange, I mean, that the call did take place.
I'd like to move on, please, and it's a document that you've already been taken to. It's a part of your witness statement at paragraph 27, page 12, and the inquiry number is 000237819. this is the part that I would like to take you to about devolved administrations, and we've already had a look at this, and that you've indicated that whilst there was good cooperation with Northern Ireland and Wales, it was less effective in the case of the Scottish administration. And you've made reference to keen to announce measures either before or after. You describe this as more political than data-driven. The inquiry, I think, in relation to this matter has already heard evidence from a professor indicating that this particular message, the Stay Alert public messaging, was one which is the worst of all combinations because it doesn't tell you what to do and it tells you to worry. This particular messaging aside, what other decisions taken by the Scottish Government do you consider were more political than data-driven?
I think it's really what I said earlier. Whatever the decision that was taken at a COBRA meeting that was in discussion with Wales, Northern Ireland, whatever that decision was, it would happen in Scotland as well, but it wouldn't happen on the same day. It would never be coordinated. There was always a desire for it to be a Scottish decision, not an English decision. And it was always the same decision, but it would happen 2 days earlier, 2 days later, or whatever.
So when you say that the reasons appeared more political than data-driven, what do you mean? That's not about the same message, is it?
That is what I was meaning by that statement, that the data was saying we should do this or that. Whatever it was, there was this desire in Scotland, and please excuse me saying it, to be different all the time. I think that was a political move rather than a practical move.
I think the inquiry has already heard a lot of evidence about the data suggesting that matters should have taken place earlier and that decisions should have been taken earlier. Indeed, I think you yourself said so earlier. Might that, rather than simply being a desire to be different, in fact, be something which was data-driven because you were trying to implement matters more quickly?
I mean, this was a general statement I was making right through the COVID period. There were at various times changes. There were rules which we were imposing across the country, the rule of 6, the 2-metre rule. There were various other rules that were being developed, and I can't remember them all now, but I mean at the time they were very much sort of things you discussed every week. And it was just every decision that was taken, Scotland always went slightly differently in timing to the rest.
You've mentioned the rule of 6. I wonder if I can take you to paragraph 49 of your statement at page 21. You'll recall my learned friend has already asked you about this matter, and you explained it wasn't simply sitting round and deciding that 6 seemed like a good number, but it was made in combination with the experts. I wonder if I can ask you to reflect on paragraph 49, where it says, reductions in the ability for people to meet later, the rule of 6 was interpreted far too harshly, in my view. From memory, the rule of 6 was an arbitrary number, and this concept, as well as others such as household bubbles, were introduced as a means of compromise between isolation and full contact. Now, I wonder if I can ask you to reflect upon the view that you believe that the rule of 6 was an arbitrary number and how that might square with your view that the decisions taken by the UK government were more political than data-driven?
I'm not arguing that the rule of 6 and 6 was the right number. What I am saying is that along the line, you have to have a decision which is right across the UK. And so everybody understands whatever the rule is. And it was this constant pressure for something to be different. And that's really the point I'm trying to make.
Well, the question with respect I'm asking is, did these decisions taken, the rule of six, represent a decision taken by the UK government which was more political than data-driven?
No, I don't think so. I think it was the best compromise people could come up with. It was done in conjunction with medical advice that was given. It was also discussed extensively amongst the chief medical officers. These were things that were discussed quite widely before they reached a decision-making point.
But then you describe the number that was chosen as arbitrary.
My point is, I am not sure, and I cannot remember why 6 was not 4 or 6 was not 8. It was a number that was decided at that time, and I was not party to making that decision. My point is, I think it did create all sorts of problems for people. I think it was very difficult. It was seen as being very unfair, and there were a lot of examples of that unfairness.
I would like to turn now to a different issue and to take you to an excerpt of some handwritten notes that were made, and they've been typed up. These are notes made by Patrick Valance on the 28th of November 2020, or reflects a discussion at that particular time, and that is INQ 000273901. And in order to orientate ourselves, if I may read, PM meeting retiers advice from Gold. We can't have endless boundary disputes. We have to make arbitrary and draconian decisions. PM wanting to put more into Tier 1. CMO says, I wouldn't put anywhere in Tier 1, as Tier 1 all went up before, and this Tier 1 is even less stringent. Selling the testing on Liverpool got out of this by testing. Not true. It made minor difference. Also, endless references to what focus groups said. Ed Lister, all our feedback is that the more you put in Tier 1, the better. The exact opposite of what we need to do. This is all a game of getting votes. PM is the only rational voice in the political side. PM arguing for going harder and says more jobs will go if this thing takes off again. Simon Case comes in and says, if you put everyone in lower tiers and then add Christmas, we'll undoubtedly have to do another national lockdown. PM, what this disease has taught us is that hoping that something will turn up and it will be okay is fucking stupid. Keeps coming back to hope that testing can help. Now, what I want to ask you, do you remember that particular meeting?
No, but I can remember that kind of argument.
And the feedback which you were giving there, the feedback which you describe as all our feedback is that the more you put in Tier 1, the better. What was that feedback from?
That was the feedback from local authorities up and down the country who all wanted their hospitality sector opened up as soon as possible. And that was the general view. Everybody wanted to be in Tier 1, so we were then having arguments in the north to move them to Tier 2 or ultimately to Tier 3.
And would you agree that that feedback that you were giving at that time and the view you were expressing wasn't scientific feedback or data feedback, it was political feedback?
It was political feedback, but not party political feedback. It was political feedback from the leaders of local authorities up and down the country.
Those are my questions, my lady.
Thank you very much, Ms Mitchell. I've just got one question, Lord Anthony Lister. Given what you described as the personality clash, particularly with Mr Cummings, and you having acted as an advisor to the Prime Minister, is there anything one could do to put in place any kind of structure about the role of the special advisor that might prevent this in the future if you had such a personality clash, or is it inevitable?
I think I think there's two. Can I answer it in two ways, if I may? I think you have to think about the way Boris Johnson likes to work. He's a journalist. He always likes to have both sides of the argument on the table. That was something, I suppose, as a journalist, he just automatically felt was the right thing to do in making a decision. One of the problems with people like Dominic Cummings is that they always believed that their decision or their view was the right view, and there was no alternative view. That creates that tension. That's one issue. The second issue is I think there wasn't a very clear line of responsibility in Downing Street, and I think that was a mistake. And I think there should have been clear lines, clearer responsibilities, and I think that would have eased the situation. I also think people needed to be treated a little bit more respectfully than they were. Some of those WhatsApp messages, and you've seen them, are pretty appalling. And that's something that I felt very uncomfortable with.
You talk about clearer lines of responsibility. That's really what I was getting at and what has been occurring to me as I've been listening to the evidence. But special advisors, I think they're temporary civil servants, aren't they?
Yes.
How could you create the clearer lines of responsibility? Because although they're temporary civil servants, they answer to the minister rather than to the permanent secretary. They are there to assist the to assist the minister, but I mean, for them to be effective, I think people need greater training to understand that in government, in the civil service, you can rarely get anything by instructing somebody to do it. You actually have to sell it to them and sell it to them as being the right decision for the country, for whatever it is you're trying to sell. I don't think it's actually much different in business, actually. It's you always have to sell the message. And I think the idea, and some of the special advisors, I think, had it, was that they had the authority to act on behalf of the minister and just give instructions, and that just causes resentment and difficulty. And I think that's what you picked up from some of the earlier evidence that's been heard, and that's certainly how I read it. Thank you very much. Sorry to use you as if you were the author of a seminar. Thank you for your help.
Maybe that's the end of the evidence for today.
Thank you. 10 o'clock tomorrow, please.